We got your 6.
At 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
Sinya uli di sombranza tanmak Etsuita saluda antes di niga Radzaudzan malak estrezas durante todo el memu a nogi distancia como kupugi palu zangiman malak guafi con una sughiairi preba tu la noci nai banderata gaigi pues atan fanni bandera kau Esta pagua pumalapa Giluk tanu man libri Sentami ti man ko badi
everything so easy. Boy, I've been faithful. Promise not to hurt your heart. Swear I'm not able. I loved you from the very start. My love's on the table. Take it how you want it, boy. Yeah. Take it how you want it. Boy, I've been faithful. I promise not to hurt your heart. Swear I'm not able. I loved you from the very start. My love's on the table. Take it how you want it, boy. Yeah.
Go.
Take it how
Hey,
you
good
want
morning.
it, boy.
Morning.
Take it how you want it.
6:18.
How you like
Good morning, Guam!
How you like
Right on.
when you need
Good morning. I hope you wash your hands. I don't want to talk to you guys unless you wash your hands and your thumbs. Don't forget, wash them thumbs up, man. You touch a lot of stuff with your thumbs. Especially you hitchhikers out there. Hey, it's 6:18. Good morning, Sabrina.
Good morning. How are you?
I'm freaking out.
Yeah.
I am freaking out. Because I just unplugged yesterday. I went up to the top of the mountain. I've been wanting to do this for a while. I went up to Mount Lam Lam and I just was like, disconnect from everything. I saw the sunset, which was just so thank you, Lord. That was awesome. Yeah, I went all the way home, went to sleep, woke up and was like, what? 16 new COVID-19 cases? 7 hospitalizations? Yeah, so we're gonna have Lillian Posadas from the Guam Memorial Hospital on in the 7 o'clock hour to talk about the latest with our public hospital and its response. And there's definitely some responding going on as we are. I believe this is that surge, right? I mean, the doctors said, hey, flu season, look out. But, man, I don't know what happened, but this is just out of control.
Yeah.
It's out of control. And
I remember when I left, I messaged Joan. It was around almost 4 o'clock, and I was like, wow, Joan, the SIT report's not out. This kind of worries me because every time it comes out late, it's usually, a significant number. And I went to sleep, woke up around 8 o'clock, and there it was, 16.
Yeah. So the SIT rep is situation report, and the public health, they release it every day on their website, and basically it's a compilation of all the different numbers from hospitalizations to even they break down the info in a pretty detailed way, right, Bree?
Yeah, but let me just follow up because I didn't mean the SIT report. I meant the Joint Information Center.
Right, okay,
when
okay.
they release something. But even the SIT report, it hadn't been updated. The dashboard is updated, but the SIT report, let me see if it has been.
Yeah, this is on a public health website. This is actually...
Yeah, it hasn't been updated.
Wow, that's interesting.
Wait. What's today?
Today is the 12th of August.
Okay, yeah, I was updated yesterday. 434 cases.
Okay.
9 positive. Yep.
Okay, so...
You said 7 in... what did you say? 7 hospitalizations?
Yeah. So we're going to
What's
get
this?
Lillian on to talk about that. Last I saw, there were 7 hospitalizations, and as of
35 in the isolation facility.
yeah. So this is, guys, we got to do our part. People are still kind of acting like everything's cool. They're just going around doing stuff. That's kind of if you don't have to go anywhere, don't go anywhere. Nobody says you got to go places. You can still stay home. All right, mask up. Sorry, that just...
The mic works.
It works, definitely. So 7:05, guys, I've got a interview with Dr. Michael who is on the Governor's Physicians Advisory Group. And as we discussed briefly yesterday with Dr. Hoa, Dr. Michael has COVID-19. So a little bit after 7, we're going to catch up with him, and we're going to find out all about how he was exposed. And you guys, you're going to be surprised about how a doctor who's on the Governor's Physicians Advisory Group was exposed to COVID-19. And I think it's a great way to let you guys know that we got to take this serious, okay? So that's going to happen a little bit after 7. Again, Lillian Posadas from GMH 7:20, 8:15. A lot of people talking about the decision that came out of the special board meeting yesterday. School is still on, opening in 5 days, August 17th, right? Which they better tell DPW, because DPW, last we heard, they're still trying to figure out the busing. So we got Superintendent John Fernandez, 8:15. We'll do that. At D2020, 9 o'clock, our last couple senatorial candidates. Both from the Democrat side, we've got a new candidate, Chris Carrillo, and incumbent Senator Joe San Augustine. We'll also catch up with Maria Pangilinan from the Guam Election Commission as in-office voting is ongoing. And I'm starting to see a lot of posts, Bree, where people are encouraging other people to just go and vote early and get it over with, especially because with the way things are going, we don't know what it's going to be like when the primary election hits. And I don't know if you want to be out there voting and if things keep going the way they're going. So get it done. Like the Democrats say, vote early and often. But you can only do it once. At the GEC, they've got it down, guys. It's in-office voting. They do it by appointment. I know that they have also had spots where it clears up and they'll give us a call and they'll say, hey, can you just let people know that we've got a bunch of openings this afternoon? So we'll get Maria on the phone and find out how you guys can kind of go and take care of, that very important civic duty. And this election is, it's very important to vote in this primary election.
If I could just add to that, Chris, some people were wondering, because I believe when the very first day that in-office and absentia and voting in absentia started, what was it? The next day we reported that there were 80 people that actually cast their votes. We had a story, and that's up right now on KUAM.com. If you're wondering how many people have actually done so and voted, over 800 Guamanians have actually cast their vote in that format. So it is starting to work. But again, you're wondering about the just the outbreak of cases and everything. We've been discussing this so many times on our show that there were at least 4 major events that we're going to have to go through as a community to see the impact. The governor declared us on semi-lockdown in the beginning, and then we're going to have to go through the reopening of businesses. We've done that. We're seeing the impacts of that. The reopening of schools, we're kind of in the middle of that right now. GDOE has yet to begin. The one that kind of I've been eyeing is the election. We're talking about that, and how many people actually make it out to the poll. I was actually wondering, just curious and everything. I had this conversation with Bria, and maybe pose a question to you. Do you know if on Guam law is there a minimum voter turnout that has to actually cast their votes, whether at the polling stations or whether in absentia, in office voting, whatever.
We're going to ask Maria, but you're right, Jay. If
we could have historically low turnout votes if people just get too paranoid and they freak out.
Right, and so it's something like in order to move on to the general, you got to have a certain percentage of ballots. So we'll ask Maria about that, but that's a good point. Yeah, so guys, make those appointments, and we're going to get GEC on at 9 o'clock hour just to tell you how they're making it safe for you guys to go cast that ballot. 626. Bree, let's go ahead and move on to do news.
Sure.
From the KUAM news team with the very latest, it is our link update. We have Adriana Cotero. Good morning.
Half a day. Good morning, everyone. I'm Adriana Cotero with your headlines here on the link. The latest data from the Guam COVID-19 situation report: 16 new cases of COVID-19 was reported out of 541 test samples. 9 cases tested positive at Public Health, 3 tested positive at American Medical Center, 3 tested positive at GMH, and 1 tested positive at DOD. These cases are all under investigation. Of the new cases, 7 cases were identified through contact tracing, 4 cases had recent travel, and were identified in a quarantine facility. To date, there have been a total of 434 COVID-19 cases with 5 deaths, 104 active cases, 325 recovered, and there are 7 hospitalized. Of the 434 cases, 384 were civilians and 50 were military service members. The budget debate continued Tuesday at the legislature. Senators are now diving into the details of how much each line agency will get for this upcoming fiscal year. But before that, they talked about the critical issue of how much money they have to work with. Nestor Lecanto reports.
I'd like to recognize that we have Mr. Byrne. The governor's office and the legislature's Office of Finance and Budget are only about $7 million apart in their general fund revenue projections, $782 million versus $775 respectively. But there was still a heavy dose of skepticism in the Congress Hall about how realistic those numbers are given the plunge in business activity due to the COVID pandemic.
We are in a very dire state of fiscal fragility. We are on thin ice, maybe not today, because you got the stimulus, and maybe there's a stimulus in sight. I'm talking about the mid to long-term recovery of the territory.
But Budget Director Lester Carlson says they've reviewed the variables and already dropped their original projection by $40 million. These are the numbers now, he says, and they're sticking to them.
You're asking me, do you stand by the fiscal 21 revenues as presented? I stand by firmly, Senator DeCastro, on BBMR's total general fund recommended levels of $781,697,305. I affirm, sir.
And Speaker Tina Muñoz-Barnes sought the same sort of reassurance from OFB Director Steve Guerrero.
This invisible war has literally taken a big effect on everybody around the world, but here for us, here in our small communities, how do we relate and how do we be fair and how do we continue to maintain the livelihood or the sustainability of us moving forward to be fair and not just take away, because if we take away, we're going to see our community hurt even more.
For now, everything's all right because you're employing, you're receiving federal funds. Federal funds is helping the bottom line as far as revenues are concerned. But once this whole thing comes to an end, there's no guarantee that, we will continue to receive, at least generate the levels of revenues we're experiencing now.
Perhaps Guerrero summed it up best. For now, it's all assumptions, he said. We just got to make the best of it. For Guam's News Network, I'm Nestor Lecanto.
Meanwhile, the governor's office issued a news release Tuesday saying it has slashed the general fund deficit by almost half, from $83.4 million at the end of fiscal year 2018 to $47.8 million by the end of fiscal year 2019. The statement was apparently in response to recent public criticism from former Governor Eddie Calvo. Asked about it during the budget session, Administration Director Edward Byrne explained it this way.
An increase in net assets of $30.1 million and a decrease in liabilities of $5.5 million. The increase in net assets are of two types. One is a slight increase in cash of $13 million, but the big increase was in receivables from outside of $11.5 million and from other funds of $14.5 million.
Adelup called it a surplus of $35.6 million, which it said was achieved in just 9 months through aggressive tax collections, maximizing federal funds, and a strict fiscal discipline, including ongoing cost controls. But Adelup also notes that there's no actual surplus available for appropriation.
Paying down is really not a good way of demonstrating what happened. We reduced the deficit, and until we eliminate the deficit, it will always result in a change in net assets and net liabilities.
The final audited fiscal year 2019 financial statement has not yet been completed. And that's the news for now. We'll see you all here at 6 tonight on Prime Time. Now we'll see you all here at 6 tonight on Prime Time.
Thanks, Adriana. During Tuesday's special Guam Education Board meeting, GDOE Superintendent John Fernandez presented that overall district-wide 62% of students will be staying at home this school year, having selected online or hard copy distance learning, and 38% chose the face-to-face learning option. Fernandez noted that as long as the island remains in PCOR 3, the department is authorized to proceed with allowing students to return on campus on the first day, which is August 17th. Additionally, he said throughout this week, PPEs are being pushed out to all schools, and in the event of a positive case or a written protocol is rolling out in the coming days. A motion, however, was made by GEB member John Birch to push the start date back by 1 week to August 24th to allow educators more time to prepare. That motion failed with a vote of 5-3. A lot of you have been asking about community testing, and for now, there aren't any scheduled because it appears as a move toward what's called target testing, or rather, whenever there's an announcement of a hotspot or a business or school that may have a positive case and is closed, discussions are underway between the governor's Physicians Advisory Group and Public Health to establish a strike force comprised of nurses, lab scientists, and contact tracers that would be deployed to these hot sites to conduct testing on site of all close contacts. For now, though, the Joint Information Center announces that for those experiencing COVID symptoms, you're urged to call your healthcare provider. If you don't have one, you can call the Northern Regional Community Health Center to schedule an appointment for testing. The number is 635-7525 or 6. Again, that is 635-7525 or 7526. $9.5 million is heading to the Guam Regional Transit Authority. The Federal Transit Administration is awarding the grant to GRTA to go toward improving safety and reliability of the island's bus systems and enhance mobility for transit riders. The money specifically is to go toward buying new electric buses and related charging infrastructure, as well as go toward constructing a new park and ride facility in Dededo. According to Transportation Secretary Elaine Cho, the Trump administration is committed to rebuilding the nation's transportation infrastructure even through the current COVID-19 crisis. The $9.5 million Guam is receiving is part of $464 million in federal grants that will help improve the safety and reliability of transit bus services nationwide. Joining us now in our Zoom room with the latest regional headlines, we bring in our Tomas Manglonia. Good morning, Tomas.
Good morning, Bring Chris. Here's the latest making news in the CNMI with containing COVID-19. The CNMI Department of Labor is facing criticism after it gave notice that CW1 workers are not eligible for PUA or FPUC after they were encouraged to apply. They now face claims of fraud and will have to pay back what they received. We questioned CNMI Governor Ralph Torres at yesterday's press briefing. Take a listen to this clip. To shift to follow up to Ashley's question regarding CW eligibility, Governor, it was stated by Secretary Vicky Beneventi at the latest Tampa Chamber of Commerce meeting when asked about CW eligibility, she did say she encouraged everyone to apply to see if they're qualified. A number of people have felt that and have expressed that they felt misled and are now being called fraudulent. What's your response to those people who would feel misled?
Okay, thanks, Thomas. I spoke to both Secretary Labor Vicky Beneventi as well as Secretary Dave with Finance. I guess the clarification there is to accept the application and let the process go through. But in terms of denying someone, I guess that's where that's where the clarification needs to be done. I know that she has no intention in making false claim or misunderstanding into who's available or not. So I guess that's where I would like to say that. But
Governor, have you heard though that the press release said that they're fraudulent claims? That's a heavy phrase to throw at someone who was just trying to seek assistance. So what's your message to those who are experiencing this?
And Thomas, I appreciate that. Again, when the word fraudulent, right? It's difficult to just claim in general that because you turn in your document and your CW automatic, you're fraudulent. Documentation that has been made that can be considered fraudulent, whether you're CW or not. So unless it's a case-by-case basis, I don't think we should or anybody would claim an automatic fraudulent documentation simply because you have good intention and turning that in. Does that make sense?
Yes, and it seems that it might be similar than as she was explaining at that last meeting with the disaster unemployment assistance. So where can the CW workers turn to? Is it local government? Is it more federal relief? Where do they look?
So everything here, all the resources that we're getting, that we're distributing are federal funds. Those are approved by U.S. Congress and ultimately with the president. Under the COVID relief funds, CWs are not allowed to receive funds. So therefore, the government, cannot give funds on behalf of the federal program if we don't have those funds approved for them. So your question is, where do they turn to? I asked that they asked our U.S. Congress to have them included into the next batch or next relief or amendment to the relief program.
It's not clear how many CW workers out of the approximately 10,000 applied in the NMI. CNMI Labor Secretary Vicky Beneventi yesterday was not available for comment. And in related news, here are the latest numbers from the Commonwealth Healthcare Corporation. The CNMI remains at 49 cases. 25 of those cases are from travel, 9 from community screening, and 15 are from known contacts. And the breakdown for those diagnosed through travel, 20 are from the U.S. mainland, 2 from a territory, and 3 from a foreign country. Bring Chris, that's the latest making news with containing COVID in the CNMI.
Thanks, Tomas. In national news, Joe Biden has chosen California Senator Kamala Harris as his running mate. The decision comes more than a year after Harris, who was also a 2020 Democratic candidate, clashed with Biden over racial issues during the first primary debate. If elected, she would be the nation's first female, first black, and first Asian American vice president. The Secret Service is reviewing a shooting just outside the White House complex involving a man and a uniformed Secret Service officer. Skylar Henry has more details from the White House.
The Secret Service interrupted President Trump just minutes after he started his coronavirus briefing Monday evening.
Excuse me?
The president was taken to the Oval Office because a Secret Service officer had shot a man just outside the White House grounds.
The suspect approached the officer and told the officer he had a weapon.
According to the Secret Service, the suspect, a 51-year-old male, then ran aggressively toward the officer and withdrew an object.
He then crouched into a shooter's stance as if he was about to fire a weapon.
The president returned to the briefing room as soon as the scene was secure.
I'd like to thank the Secret Service for doing their always quick and very effective work.
The Secret Service has released very few details about the suspect, but the White House says the incident was politically motivated.
It's scary, I will tell you. It is scary that people constantly shovel hate and worse toward the president, the vice president, their families, the people who are closest to them. And that has to stop. I guess people are getting very nervous that he's going to get 4 more years.
White House advisor Kellyanne Conway also tried to link the suspect's actions to nationwide protests to cut police budgets. President Trump has made law and order a key theme of his re-election campaign. The Secret Service hasn't discussed a motive for Monday's incident. Skylar Henry, CBS News, the White House.
Later in the link, our Decision 2020 coverage continues with senatorial candidates. Democrats Chris Carrillo and incumbent Senator Joe S. San Augustine. We'll also kick off our interview with the mayoral candidates. Joining us are Democrats Asan Maina candidate, who will go head-to-head in the primary, Frankie Salas. No, that's not today?
Sorry, Bree. Mr. Mayor Salas actually had a death in the family, so
okay.
Our condolences. He had to cancel last minute.
John Gumatauta?
Yes.
All right, there you go. And also joining us is Andy Santiago.
I told you from Umatic.
Okay.
I told you, remember?
He's very, very excited, by the way. He WhatsApped me twice and said he's really looking forward to coming on the show.
Nice, yeah.
Okay. Well, that gets underway at 9 o'clock this morning.
Right. So as we start to interview these mayors, you guys in the different villages, tune in. So, we get Umatic this morning, and we've got Asan. So I want to see all my Asan, Maina, and Umatic people out here. Hey, good morning. The show at 6:41 is proudly brought to you by Apoca, which is distributed on Guam by Ambrose Inc. They've got the peach tea, the lemon iced tea, and cappuccino. Also, IT&E and Calvo Enterprises. We're going to go behind bars, but it's okay. We'll be able to go back out again with Anton Uggan from the Department of Corrections. We'll take a short break and come back with more of The Link on The Breeze. 93.9. Good morning, Guam.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
We got your 6.
At 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
Half a day. I'm Dr. Jana Manglonia, Medical Director for Public Health. We all play a role in slowing the spread of COVID-19. We must continue to stay strong and practice everyday preventive actions to keep our island safe. Maintain a distance of 6 feet between yourself and others. Wear cloth face coverings in public settings. Wash your hands for at least 20 seconds. If soap and water are not readily available, use alcohol-based hand sanitizer that contains at least 60% alcohol. Clean and disinfect frequently used surfaces. Avoid touching your face. Stay home if you're sick. Let's protect ourselves, our loved ones, and our communities. Prevention saves lives. For more information, please call 311 or check out our website at dphss.guam.gov.
Hey, good morning. Good morning on you. Good morning to our viewers on KUAM TV 11. Good morning. Good morning to our viewers on our Edward R. Murrow Award-winning social media networks at KUAM on the KUAM News Facebook page. Good morning. Good morning, Vivian. Good morning, Mr. Chris. Good morning, Madam Clarice. Thank you, guys. Also, you check it out at KUAM.com, the KUAM News app, and right here on the all-new Breeze 93.9, where your go-to jam is always coming up at 6:48. Let's go to the Zoom room and get from the Department of Corrections, Major Anton Uggan. Good morning, Major.
Good morning. Good morning, Chris.
Good morning. Thanks for joining us so early. First, let's just start. I want to, on a personal level, how are you feeling about the news here that our governor has tested positive for COVID-19? And just, I want to make sure you're okay as we're in the midst of this big surge. So first off, how are you, Major?
I'm doing good. For asking.
Do you have kids going to school?
Yes, I have two. I have one going to Mark Carmel and the other to Notre Dame.
Oh, okay. So they just started, right? Notre Dame just started?
Notre Dame had their orientation yesterday.
Right.
Her first class is next week, and then Mark Carmel was yesterday.
Are you doing face-to-face or remote learning?
I think for Mark Carmel, it's a face-to-face, and for Notre Dame, it's a hybrid.
I see.
So she'll be in class a few days out of the week, and the rest will be home.
Right.
Online.
All right, good to know. And how you feel about that, Major? You confident in the school's measures?
Well, I mean, I know the measures that they're taking is basically universal.
Right.
A lot of it just depends, I guess, sometimes on the kids, if they're going to be able to comply with all the requirements for 8 hours a day or for the days they're there. It's just, it's a tough situation for everybody.
Right. Yeah. How old's your Mount Carmel student?
She's 12.
Right. And so you have that conversation, Major, about, hey, when you go to school, don't be touching everything. You know what I mean?
Mm-hmm.
All the time. I mean, she's got a bag full of wipes, hand sanitizers, alcohol, 6 different masks. We even got her a little portable fan because Mark Carmel has decided to, I guess, turn off the air cons.
Right, yeah.
Oh, wow.
And so there's no air cons in the classroom. So my daughter has a small little fan to go with her.
Oh, that's cool.
Wow. Prepared.
Wow, can you imagine? I mean, every school year, of course, the parents, we hear it, the list of supplies. I mean, this school year, though, wow. You're going to spend like $80 on just hand
supplies.
sanitizer and just like sanitizing stuff.
One of the things on the list for my son was a box of masks.
What?
Wow. That's different.
How much did you spend on that type of stuff, Major?
Well, you know what? Honestly, I don't know, Chris. My wife handles all those financial items.
That's the boss.
It's above your pay grade, huh?
My pay grade. I just bring home the money, and where it goes after that, I've just learned not to ask questions. And just nod my head in agreement. So.
And also the honey-do list, right?
Yeah. You ask more questions at work.
Yeah, I don't really ask questions. I mean, at work I'm a major, but at home,
you're less than a private.
My daughter's, I'm in the private. I'm not even authorized to speak on behalf of anything without getting the wife's permission. So that's just the way it goes. I've learned to deal with it.
It is what it is, Major. Right on. Okay, now that we got everyone feeling sorry for you, let's get to official business. What's the latest, Major? We know that you guys got tested over at the prison, but what's been happening there since we last spoke?
Well, on July 30th, we tested 195 staff, and all those that were tested came back negative. So that's a good thing. We are working on the final plans to test the inmates, all the 600 plus inmates and detainees, both in Manila and Agana. So we're working on that to finalize it. Probably by this week they'll be tested. We have some public health nurses coming in today for a site visit just to look at the outlay and work with our the management as far as the flow. And so we're hoping to have that done soon. Once that's done, then we'll look at the incoming for the inmates. We have not had incoming since a few months back, at least. So once we get this baseline and we get this thing squared away, then we'll work on the incoming for the inmates and the family. What else? I mean, you know, other than that, we're just trying to hold down the fort and protect our inmates as much as possible.
How are the inmates doing, Major? Are we seeing like heightened anxiety and stress? Is there an increase of maybe fights, that type of stuff at the prison?
No, we haven't seen an increase in fights, but of course the stress and the tension of, especially since there's no visitation, right, and they haven't had visitation for months. It's very stressful, but you know, they do get access to the phones, basically to call their family. The phone is basically unlimited right now, so they're not even being charged for it. And then you know, management, they explain to the inmates why we're doing what we're doing. We've had the warden and the other majors had different meetings with the inmates, again, just keeping them abreast of what's going on. And for the most part, they understand that we're just trying to protect them and their family and the staff of DOC from this this invisible enemy, as we call it.
So how just on average, Major, just because I've never asked you this before, but how many like fights and stuff do you guys see in an average day at DOC?
Not necessarily a day, maybe one a week, maybe. I mean, there could be several weeks when there's no fights.
Okay.
Again, we still do our contraband checks and stuff, and I think last week we found a cell phone, found one cell phone, but
iPhone or
yeah,
what?
Huh?
Was it an iPhone or Samsung?
You know what? I didn't see the final report on what it was. I just know they found it, and it was already turned over to GPD.
Probably that was the new iPhone.
Something like that though get in if you're not accepting incoming.
And there's no visitation.
I don't know. Honestly, I don't know. Some of them could have been here for a while, and we just never found it. So now, other ones, I just, I don't know. I mean, I'm hoping it's not staff, but you just sometimes never know.
What about the stuff that's going over the fence?
The contraband?
We've had one or two, I think, in the last few weeks thrown over, but we got it. It got landed in an area, and no one was able to retrieve it, so we end up finding it. We still have them. We still have those attempts.
What are they throwing? Is anybody trying to throw over like hand sanitizer and wipes and stuff? Or is it just all, crack and snuff?
Most of it is tobacco products. Lighters, cigarette, Copenhagen. Sometimes we'll find drugs. I mean, one time we had a jar of Doni de Nancy thrown over. So someone was craving Doni de Nancy.
I wonder what kind it was.
Yeah, what kind was it?
The red bottle, the one is like $16.
The Drizzle?
Yeah. No, I don't think it was that one.
Oh, that's good stuff there. I want to ask about, with the surge in COVID cases on Guam, has there been any talks to test some of these arrestees that are coming in and pretrial detainees over to the Hagåtña lockup? Because you just don't really know, right?
So one of the things, Sabrina, and our plan is that they're looking at getting a testing machine, the ones, and again, I can't recall the name of it, but one of those machines that they use to test.
Like a rapid testing type machine, like an Abbott ID?
Right. And so they want to get one or two for DOC, but I know one specifically for Hagåtña. So that when the overnighters come in, the nursing staff can go ahead and perform a test on them before as part of our processing process that we use when we intake.
You have nursing staff in Hagåtña?
Yes, we have nursing staff in Hagåtña, and we have them in Manila too.
Right. Major, we actually had a call here, and logistically, I don't know how this is going to work, so I'm going to just take this lady out a question about the testing that was conducted at the prison. Good morning, ma'am. Go ahead.
Hi, good morning, Major. I just heard that you tested your staff or DOC staff, over 100 of your staff. Was that a decision of the authority, or, I mean, was that also logistically organized by the authority?
What authority? Are you talking about DOC or are you talking about Adelaide?
DOC, yes, by DOC. Or was that left to the employees to decide whether they want to be tested?
Yeah, what was the...
Was it a mandatory testing or was it voluntary?
Mm-hmm.
Right.
Yes.
Anton?
No. Okay, so the director put out an order. It was a mandatory test. He wanted everybody to get tested. There were some that did not because for whatever, they're on military drill. They were out already, maybe personal issues and family issues. So some of them, out of the 220 some employees, there was a few that didn't. Some of them that did not take it, they went to the community outreach program and they took the test. Some of them went there. We're looking at when we test the inmates, prior to testing some of the inmates, some of the staff that missed the testing will also be allowed to take the test. But the director wanted everybody to take the test. I mean, I know some were hesitant to take it. I mean, even I was, but again, you know, we're trying to protect the staff and the inmates. And so it was mandatory, but nobody was disciplined for anyone that didn't take it. There was no discipline handed down, you know, but again, it was something the director ordered and you know, I agree. We gotta test our employees. We gotta make sure they're safe. And what better way when bringing the public health to our facility? I mean, they didn't have to go outside and stand in long lines. They went into our facility. The whole thing took about 3 hours to get the staff there. It was a real smooth operation. And again, the ones that tested negative. I mean, it doesn't mean because you're negative that you can't get it the next day, obviously. But we needed to start something. We needed to do a baseline. So yes, it was ordered, and again, most of the staff took it.
How many didn't?
Out of the 195, maybe about 20.
Mm-hmm.
But again, some of them are due to they were out on military or other pre-approved leave and weren't able to make it in time.
So how many
and
were...
some who just didn't want to take it.
How many were just like, no, I don't want that thing up my nose?
You know, I haven't heard of any straight out defiance of the order from the director.
Okay.
Most of the ones that didn't take it, like I said, there was about a handful that didn't take it, but they already went out the next day and took one of the community testings sites, and they took the test there, and they reported back, hey, sir, I took the test, and, you know, this is our results. Okay, good to go.
Thank you.
Some of them,
ma'am?
Some of them have been tended about 2 or 3 times because of the contact tracing that took place a few weeks back. So some of them even had more than one test done to them.
Mm-hmm. So for the people that didn't take the test, you said there was no disciplinary action or anything, but were they like moved to a certain area in DOC to work or reassigned somewhere?
No. Nobody was sanctioned. Again, the whole thing on the test is that no one was showing symptoms. It was just a precautionary measure. No one was, if they were showing symptoms and other things, it would have been a little bit different, but they wouldn't even have been allowed to work. But no one was showing symptoms. It was just a 100, you know, the director's plan was to just test everybody. And then our next step is the inmates. Now, you know, will some of the inmates refuse? It's possible. It's possible some may refuse. But we try to explain the importance of it, especially if we want to start getting visitation going. You know, we want to start setting up some kind of visitation down the road. We need to know where we stand. We need to know where we're at right now. And so that's why we're going to be moving into the next phase. Even though, I'll make it clear that at this time, no inmate has shown any symptoms to date of any kind of COVID-related illness.
What did the officers, what were the reasons the officers said that they just didn't want to take the test?
Well, some of them may not want to take it just to it's a medical procedure, right? And they just didn't feel comfortable taking it. Some were worried about, you know, the process, and you know, I mean, even me, when I saw the swab, I was like, oh my goodness, you know, I didn't want to take it either, but I sat through it. No one, like I said, no one's really expressed protection to a certain degree. I mean,
Yeah, Major, stand by, Major. Thank you, ma'am, so much for the call. Okay, are you satisfied with the answer?
Yes, I just want to commend the DOC, the Director and Major, for directing or for making the decision to test the employees, because I know of employers and other agencies who have known that their employees tested positive and kind of just left it for the employees to decide whether they want to get tested or not. And, you know, I just like I commend you for the precautionary action you're taking to protect your employees.
Which agencies, ma'am, are you talking about?
I'll just leave it at that.
Give us a hint. I mean, you know, so we can
It's
look
been
into
on
it.
the news lately.
On the news lately. DOE?
I'm sorry. I'll just leave it at that.
Thank you, ma'am.
Thank you.
Okay.
Is that a good guess? Or
You're always a good guesser. Major, so you mean to tell me that those big bad corrections officers with all the tattoos and they're just like their sleeves are about to bust because of that bicep game? You mean to tell me these guys who have on average about 70 pounds of tribal tattoos on their body, you mean to tell me that they're scared of a Q-tip going up their nose? Oh my God.
Most of them took the test, but again, you see that Q-tip, it would, you know.
Size does matter when you see that Q-tip. You're like, whoa. Oh. Describe the process, Major, because yeah, people wonder about
better
it.
not get arrested anytime soon.
It's one of those questions that we always get about how was it taking the test. So how was it to take it for Major Anton Huggen?
Well, it was an experience when the nurse explained to me and showed me the long Q-tip swab they're going to use. I was like, are you going to clean my ears with that too? Because that's pretty long. But it went up and I got teary a little bit. You know, but you have to hold it still. We had one, our other major, I think, they took it and they're putting it in the container and it dropped.
Oh no.
So so she unfortunately had to go through it twice. And so that was a unfortunate there event, but I'm happy I took it. I'm happy I took it because I know that I didn't have it at that time and my family doesn't have it, and I'm not capable of spreading it here at work, so I just maintain all the other precautions that we're still doing.
What about
right now, I'm by myself here in the office. So.
Right. Major, you said testing inmates is next. What's the timeline on that?
Well, sir, we're looking at doing it before the week's over.
Before the week's over. Wow. So it took 3 hours for the 190 staff, so that's 600. So that's probably going to take, what, 2 days or something?
Well, we're looking at
a whole day.
Manila might be 1 day, or depending on how many we get to Manila at a time, it could be 2 days in Manila and 1 in Agana. But again, GMH is coming in today. They're sending about almost a dozen nurses here tomorrow, or when it takes place. And so we're going to try to move it as fast as we can, and again, just take it from there and evaluate the operation and see how we can improve it and make it work faster. It's our first time ever doing something like this, so
So just real quickly, in lieu of not having those rapid test kits, how are you guys dealing with the overnighters that are coming in and trying to minimize exposure, because you don't know whether they could or could not have COVID-19? What are you guys doing? What kind of precautions are you taking to ensure everybody over there at the Agana lockup, to include staff, are safe?
Well, all the staff are wearing masks. They're given masks, and so is the overnighters. As you can see on some of the mugshots, some will have their masks around their neck, so they're all being issued a mask. They are putting in an isolated area, again, you know, considering our space and the population. It is a challenge, but we do separate them from the inmates that's been there for a while, right? So they're there and they're seen by medical staff, and their temperature is taken daily, sometimes twice a day, just to ensure that, you know, no fever or nothing happens. And you know, we're just being diligent on that, and so far so good. I mean, we've been able to manage it, and hopefully once we have the other testing and we're able to test them as they come in, that'll be better for our operations. But you know, for now we're doing the best we can of what we have, and
Okay. Well, thanks a lot, Anton. I guess we'll check in with you maybe tomorrow or later on this afternoon about when you guys begin testing inmates and detainees over at Mingilau and Agania. Thank you so much for your time, and stay safe.
Okay. Thank you.
Thank you, Major. Wash your hands.
Yes.
Okay. 707. Good morning. It's the Link on the Breeze 93.9. Yeah, so we'll be sure to ask Lillian Posadas of the Guam Memorial Hospital about that testing effort. It's kind of interesting that we can't have a community mass testing because of a shortage of nurses, especially since the GDOE nurses have kind of gone back to GDOE as we get ready to reopen the schools in 5 days. So I'm kind of thinking if we can test the inmates, then maybe we can do a community testing because we haven't.
Mm-hmm.
You know what I mean? What's the difference? It seems like it would take the same amount of people to test, 600 some inmates. So we'll find out about the next community testing. I know a lot of you guys are asking about that. They've kind of re-geared it towards, what do they call it?
The strike force, the target testing,
right,
where, whenever there's a positive case, like if, for example, like Crust Restaurant or FD, what's happening is these tier 2 clinics, SDA, AMC, they're being rushed by people because they're not sure. Oh, maybe I was in contact with somebody.
Right.
So what they're hoping to do is do these target testing and going and deploying, resources to like Crust, like I said, these hot spots, hot sites, and do the contact testing there, or testing all close contacts.
Right, and so that's why we're seeing these. Well, we're seeing these high numbers because people aren't adhering to the measures that we're supposed to be adhering to. But also with the targeted testing, obviously there's a ton of community spread going on, and that's why they target these people. They go in and test them, and we're seeing the positives because people have been exposed and come into contact. That being said, our next segment here, I was able to sit down with Dr. Michael of the Governor's Physicians Advisory Group. Guys, you're going to want to listen up for this interview and watch it on our Facebook live feed. Dr. is going to share with us his story about being positive for COVID-19. Thank you, Dr. for joining us. Of course, you guys know Dr. He's got a big presence on Facebook from One Love Pediatrics, and he's also a member of the Governor's Physicians Advisory Group, and we've had him on the show a bunch of times. And I was kind of cruising my Facebook feed, Doc, and I saw your face, and I really had to do a double take because you did a post, and I was reading it, and it said that you had tested negative, but that a couple days ago you actually had tested positive for COVID-19. And right away, of course, you haven't been on KUAM a bunch of times. I mean, we were just really concerned and wanted to reach out to you and make sure you're okay, and then maybe have you tell your story for our listeners and our viewers. So. Doc, I guess if you could just take it away, take us from the moment of exposure to where we're at now, which it looks pretty good, you sitting outside.
Yeah, thanks, Chris. So I was exposed Tuesday night. It was a small gathering at a friend's place. Nobody was wearing masks, but nobody was symptomatic either. And then Thursday, I found out that one of our friends at that evening tested positive, and so then like, oh, now I have a confirmed exposure. So I actually went straight to GMH, got tested through Employee Health, since I'm still a hospitalist there, and I tested negative. So at that point, up until Thursday morning, I did not have COVID. Virus probably incubating, but not enough to cause any illness, nothing that could spread to anybody. So my initial plan was, I was probably I wasn't wearing a mask, but it wasn't like we were like hugging or giving high fives or anything. And I was probably about 4 or 5 feet away from the guy all night for a few hours. So I figured I'll just wait it out, probably retest myself after 5-6 days to give the virus time to incubate. And if I test negative, well, then I'm negative. But then, of course, so I was feeling really good about Friday, still nothing. Saturday, all day, nothing. And then toward the evening, started feeling a little bit of body aches. And then the chill started. And that's pretty much what I've been having, body aches and chills. So, Saturday night through Sunday night, so that would have been day one for me. That's pretty much what it was. And all I needed was a little bit of Advil, but it was pretty uncomfortable. Not I don't know if you've ever had true flu before. I've had true flu once in my life, and that was miserable. I couldn't get out of bed for 5 days. So it wasn't that bad. It wasn't as bad as that, but it definitely wasn't comfortable. And then last night, really suddenly, my sense of taste and smell just kind of dropped out at around 10 o'clock. At 8 o'clock, I had a piece of fruit, could taste the grapefruit really easily. It was delicious. A couple hours later, couldn't taste anything. So that's where I'm at now. I've been getting lots of messages from, friends, patients, people in the community who've been really touched by all that. And as of right now, thankfully my symptoms aren't too bad. I've been, because I isolate myself so early, even at home, I, made the contact tracing for public health much easier. And of course, I advise all my friends who were there that night, and they've been doing the same thing. So we've all been trying to be responsible now that this happened.
Doc, how would you describe your symptoms? Would you say they're, low to moderate?
Yeah, I would say, what I hope is the worst. So like Saturday night through Sunday night, it was annoying. I couldn't sleep very well. Kept waking up because of these chills and like low grade temperatures that came through. I never felt like I was burning up. The aches, it was annoying, not terrible. One thing I like to do when I get sick before, and this is for any viral illness that I tried doing since my years of being a pediatrician. After I feel like I'm starting to get sick, before I feel like I'm getting really sick, I like to do like a moderately intense workout to try to increase my my temperature, because fever, our body makes the fever to try to kill off the virus. I haven't really seen any papers on this. There are some papers that show like moderate intensity exercise helps boost up the immune system, but nothing about whether jacking up your body temp will kill off the virus any faster. But it's something I like to do. So I did that on Sunday, but I think it kind of backfired on me because I did one of the workouts was an ab workout, and now I was like, oh, my abs sore because of COVID, or is it because of the workout? I think it's for the workout though. Most of my body aches are peripheral.
Doc, so what I want to be careful of is people watching this and saying like, oh, Dr. Am has COVID. God, he looks great. Look at him. He's sitting outside. He's even, doing sit-ups, right? So I guess, first of all, tell us what kind of shape you're in. I mean, do you take your vitamins? Because, knowing you and seeing you on Facebook, I know you're an active guy. And do you think that had anything to do with, the way you've been able to fare against this virus?
Absolutely. There are definitely some well-defined risk factors for having a more severe case. A few that really relevant to this island: obesity, big factor for having a more severe case, type 2 diabetes, any heart conditions, really any underlying medical condition. I try to practice what I tell my patients. So, I try to get to the gym a few times a week, and try to stay active. Funny that you mentioned vitamins. I do take vitamins. I haven't taken anything special since this. I've been advised, but at this point, I think it's a little too late. I'm just going to wait it out. You're right, though, in that I really don't want to downplay COVID. Yes, for the majority of cases, it's going to be relatively mild, but that's the thing about what makes it so scary, right? We don't know who that's going to be and who gets to have the mild case and who is going to end up, in the ICU. So
let's talk about the governor now. I know the whole island does. The governor positive COVID-19. Just what are your thoughts on that? And I think it just provides further evidence that COVID just doesn't discriminate.
Yeah, it absolutely doesn't discriminate. Yeah, when I heard that news last night, I was just, I was so worried for her. But from what I understand, she's fairly healthy, doesn't have any underlying medical conditions. So I'm really hopeful that she can pull through it. Definitely, I'm way more worried about her than I am for myself at this point.
When you talk about the pre-existing medical conditions, Doc, that people might have that could be bad news and how they fare against COVID. What is it about having these pre-existing conditions that creates an environment for COVID to really wreak havoc?
That's probably a good question. It's probably way more than I can really get into off the top of my head. But in general, the way COVID damages us, we have direct viral attack from the virus. And so the receptors in our body, we have them all over our body. It's the ACE2 receptor that COVID binds to. So we have a ton in our lungs. We have some in our brain. I think that's what's being blamed for the loss of taste and smell. We have some in our kidneys, our bladder. And so if you have something like, say, type 2 diabetes, all of that is just kind of not optimal, right? And so probably the damage that you sustain from the virus is going to be a little more severe. In addition, when our body starts fighting back with the virus, there's this thing that's been going around called the cytokine storm. Really, it sounds like it's, our body's inflammatory process. And if, people have a condition that's already kind of been damaged by previous years of chronic inflammation, I can imagine that would make things a little bit worse. Interestingly, though, the ACE2 receptor is what's theorized right now is one of the reasons why kids are a little better off from COVID. They just don't have as many of these receptors. And so that's one thought of why they might be having milder cases. The vast majority of kids will have mild, asymptomatic, maybe moderate cases, but very, very few will end up being hospitalized.
Doc, could you talk a little bit about the how key timing is in getting tested for COVID? So we see, like, in your example, you've tested negative a couple of times. And so I'm thinking that people are really holding these tests up as kind of like the COVID-19 holy grail. And so when people are exposed and they go get tested and they test negative, they might be having a false sense of security, right? And go around and, infect how many other people. So and if you could just explain how key is it, the timeline for getting tested for COVID if you've been exposed?
Yeah, the first thing to know, though, is what kind of test you're getting, right? So you definitely want to get a PCR or the Abbott ID now, which is a molecular test. I would definitely advise against the antibody test for looking into an acute infection, because oftentimes the antibodies take at least a few weeks, sometimes even longer. The ideal time to get tested is going to be days 5, 6, 7 after exposure. So I got exposed Tuesday night. So if I got tested, Wednesday night, Thursday, Friday, Saturday, that still might have been a little bit too early, although by then I had to. For other people, maybe not. But yeah, you want to get tested. You don't want to get tested right when you get exposed, because it's probably going to be negative, right? The virus hasn't had time to replicate. But the other thing to remember is that it takes up to 14 days for the virus. It can take that long for the virus to show up. And Dr. Jolene Uggen has definitely told us a couple of stories during our physician advisory group meetings that she's had a patient that I think somebody that showed up like 14 days out and ended up being hospitalized. So just because it takes a little bit longer doesn't necessarily mean it's going to be a milder course.
Doc, going back to the type of test you said you think people should be taking, could you just differentiate? Because, honestly, Sabrina is our testing, she kind of handles all the testing stuff. So if I'm exposed and I go to get tested, do I want to get swabbed or do I want to get a blood test?
Oh, you definitely want to get swabbed right now. The blood test, that'll give you your antibodies, right? So we have, it checks for 2 types of antibodies, IgM and IgG. And so the IgM comes out rapidly. And so that's one where if we see it, then we'll say, oh, you probably had a recent infection. And then the IgG comes out a little bit later. The problem is, as of now, there's been really conflicting data. And so a lot of these antibody tests, we can't really ascertain the accuracy of it very well. So as of now, it's not something, if somebody just wants to do it just to know, I would say, okay, but don't take it as gospel. And if you're using it for return to work guidelines or, deciding whether or not to let a certain person get back into, a group environment, probably not the best test as of now.
Doc, I know that you got some recovering to do. I mean, you kind of look a little clammy out there, and you do have COVID. So I guess just in closing, what would your message be to people watching this?
I think I would really like to emphasize that, just because people don't have symptoms, just because it's people that you've been around and feel really comfortable with, they could have COVID. I didn't have really any physical contact with the person. I thought I was relatively distant. I still got it. I think really wearing the mask, that's one thing I didn't do that night. I was maybe a little too comfortable with my friends. Wear your mask, keep some hand sanitizer on you, make sure you keep your distancing. We all know what we need to do to stop this. It's just, I think we might have gotten a little comfortable with how well we were doing. And now that things started opening up, and, I was just like everywhere else. I was excited when to see the restaurants open up, and I want to get out. But, if we really want to get back to a normal, a lot like New Zealand has, for example, we really need to just stamp this out here first. Because the people coming in from off island, we can quarantine them, we can test them, and we're catching them in quarantine. So that system's working. But if we could really stamp it out here first, just amongst the locals, it'll go a long way for us to really reopening for real.
Thank you for saying that, Doc. And just real quick, with the clinic, I know you've got just a ton of people, parents, you've given you support. If you want to run through clinic operations, is it still up and running? When are you going to make a return to the office, just for your patients out there?
Oh, yeah. So the very earliest I could come back for CDC guidelines is 10 days after symptoms and at least 24 hours no fever. I haven't really had any fevers, but 10 days of no symptoms, I think clinic. That means I'll be back to clinic on the 18th. I still have my staff there, and they're doing just nurse-only visits and collecting lab results and phone calls. But we're also testing for COVID there too. So, people need to get tested. They can call over.
One Love Pediatrics. Doc, we're definitely giving you one love, and thank you for coming on and sharing your story with us. And we're going to add you to our list of people that we're praying for in this pandemic. So thank you, Dr. Om.
Hey, thanks. Appreciate it, Chris.
Okay, wash your hands. Wear your mask.
Absolutely. Not outside by myself.
Right. I got you.
Thank you to Dr. Om for sharing that time with us and sharing his COVID-19 story. Real key there, guys. He admitted he was at a gathering. People weren't wearing their masks. We're taking it for granted. We're letting our guard down. So this is an issue that, if doctors are doing it too, then we really got to step up our game, Guam. At 7:25, we'll take a short break, and we're coming back with the Guam Memorial Hospital Administrator, Lillian Posadas, next on The Link. It's The Breeze 93.9. Good morning, Guam.
We're celebrating your space.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
A mask should not be a sign of weakness. A mask should not be a political statement. A mask should not be another way to divide us. A mask is a protective device, a barrier to protect you and those around you from a virus. A mask is just a mask. A mask saves.
Hello, my name is Onania Snipey, and I'm here to explain the importance of wearing a mask. Mask in Turkish, polypollen awat arepotuj. Mask asisilan kitchengaw. Mask asisilan and notes mail up for us. Mask asap ew alan I move fasanigit. Mask eu pisekin appet. Mask, eu titin appet ngonuk. Me John Arum, seni someone. Mask, eu check mask. Mask, appetin manaw. Hello, my name is Onadia Snively, and I'm here to explain how important the mask is in Pohnpei. So, mask, eu kapoy magchagan perela ewa child o chuma child ka omni mask. So, mask, kaiden eu kaiden asocha kasaleta kilelen luwach. Mask, kaiden eu mask and sanga child kaon ko. Eu mask asocha kasaleta ki child pesa. Eu mask men perela. Eu men pereyuk o meni limam kau. Sang so mau me kak kamela-aranas. Eu mask, eu men perela.
Good morning, Guam. 728. It's the link on the breeze, 93.9. Great discussion there with Dr. Michael Lum of the Governor's Physicians Advisory Group. Really just wishing him the safest and speediest recovery. Take your vitamins, guys, and let's not let our guard down. You know, like Dr. Amma said, I mean, that guy is healthy. You know, he's a healthy guy. He does like mega triathletes, ultra marathon stuff. So, I mean, he's already, you know, pretty good. But the problem is so many of us aren't. I mean, not everybody's a, you know, awesome athlete. And a lot of people are suffering from diabetes and, you know, hypertension and all these plethora of illnesses on Guam. And that's what makes, you know, them more susceptible to not faring well against COVID-19. So again, guys, por favor, use your masks, wash your hands, social distance, limit unprotected contact. Wow, that sounded funny. Between people who are not members of your household.
Right. And if you don't have to go anywhere, just stay home.
Right. Lucky I'm not the public health guy. Avoid unprotected contact with all those other people. And wash your thumbs. You know what I mean? Dr. Cabrera made a good point. Mm-hmm. We wash our hands. I didn't even think about it because I do wash my hands, and I didn't know that all this time my thumbs weren't getting the attention they need. They were lonely thumbs. And so you got to really get in there because you do a lot of things with your thumbs. I mean, it seems basic, Bree. It does. And I know probably part of you is like, come on, people know how to wash their thumbs. But, I mean, if I was overlooking it, a lot of other people probably were.
True.
7:31, let's head over to the Zoom room. Standing by the hospital administrator, Lillian Posadas. Lillian, thanks for joining us.
Yes, good morning.
Good morning.
Good morning. Just so we'll play a little catch up. How are you holding up, Lillian? I mean, you've been in here since day one. Yeah. This thing just won't end.
Since March, but you know, God is holding me up. He's sustaining me and my husband. He's supporting me too, so it helps.
You do a lot of praying, Lillian? Are you a praying woman?
I do. Right. We need to.
Right.
Exactly.
You know, it's funny. I'm pretty sure God is kind of chuckling, but now me and God right now, God is like, oh, now you know me, Chris. Oh, wow. Hey, haven't heard from you in a while, boy.
Please, you are religious. Don't let your mom call into the show.
Yeah, right. I know. So
we got a great team. We got a great team here at the hospital. We have really just a fantastic team.
Mm-hmm. Lillian, you know, when we're, especially for the frontliners, when you're kind of in the trenches, you know, fighting this thing and something comes out like the governor testing positive for COVID-19, you know, things come out where we're just in this surge that you have consistently warned people about. I remember when we were reopening things, you were on this show and you were saying, you know, I don't really feel good about this. So just unpack for us, if you will, when you heard the news about the governor and just the surges that kind of led up to that, where did it put you just mentally?
Well, again, serious concern and worry, and that, the message needs to keep being pounded into the people's minds. Wear your mask, do social distancing. All the more we need to do it because, it's getting really close to home as far as, look at Dr.
Yeah.
Like you said, a physician. And so even us nurses, sometimes we, we're human beings, so we take off our masks when we're with our families and friends. And, we just have to remind each other, oops, okay, got to put back the mask on.
Right.
Yeah. So, yeah.
I mean,
it's serious concern.
And we're at a point, Lillian, where we are kind of taking it for, it's weird. I went somewhere yesterday. I was on the road. I didn't even realize, I went all the way to Umatic, that I forgot my mask. So I stopped at the store. I went to go get down, and I was like, oh my God.
You can't go.
I can't go in the store.
Yeah.
And I got down at my house, and I wore my mask down at the house. And people tell me, why are you wearing the mask? Because I need to make it a habit, and I'm forgetful. And if I don't wear this thing like all the time, I mean,
Yes.
So I got down to the store and I had to go look for like a
When I'm
T-shirt.
starting, I have my mask on because, like you say, you got to make it a habit.
Right. Yeah.
I have like a COVID kit in my car.
Right.
Like I have disinfectant spray, extra masks, gloves,
Right.
wipes. It's just all in a little in a little box that I just keep in my car just in case I forget.
Yeah, she's got it. It's stored right next to the zombie
Right here,
apocalypse
even
bag.
here. Here's my
Keep it in
other
your
kit.
backpack.
Right.
Yeah.
Yeah.
Right.
Lillian, now that we kind of caught up, let's just get right into it. Something that really alarming and scary, the increase in hospitalizations. Just if you could just go in and tell us about these 7 hospitalizations at the Guam Memorial Hospital.
Okay, we've got like 4 males and 3 females. The gentleman who's in his 30s is still in the ICU on ventilator support. The other individuals have some supplemental oxygen. Some do not have. Majority of them do have respiratory symptoms. Some of them have already pretty much broken their temperature. They're afebrile. Some are still, running fever every now and then. So we started, Dr. Agun and the physician team, they started these individuals, majority of them on the remdesivir. So, we're using the remdesivir medication on these individuals.
What is other supplemental oxygen?
Meaning nasal cannula, they get oxygen through the nasal
nose,
cannula.
okay.
Right, and they're depending on, their oxygen saturation. Most commonly 2 liters. Sometimes they go up as high as 5 or even higher, just depending on their oxygen saturation within their system and how, they're struggling with breathing. And so, because of their oxygen saturation level dropping down in the low 90s and 80s, they need supplemental oxygen.
Mm-hmm. And so when you say hospitalization, are they in ICU or which COVID care unit are they in?
Okay. We have in the COVID care 2, that's basically ramped up for ICU level of care. So the male individual who needs ICU level of care, he's in care 2. And then I think there are 3 other individuals who need telemetry monitoring in that same unit. So, we're closely watching those 3 individuals who need to be on a continuous cardiac monitoring, meaning their heart rate, their heart rhythm is constantly being monitored and watched to see if there's any aberrancies, any abnormalities, or any sudden changes in the rate and the rhythm. So those are the 4 who are in care 2, and that's in the 2nd floor between ER and ICU.
Mm-hmm.
So that's our care 2. In care 3, which is our 4th floor, the former pediatrics unit, we converted that to a COVID care 3 unit. In there, we have 3 individuals who are medical individuals. They don't need cardiac monitoring, telemetry capability. They're up and about, but they're isolated in their rooms.
Mm-hmm. So, all right, so that's a total of 7. And you said, I think when we interviewed you last time, you said in the COVID care unit 2, there are only 5 beds, right?
Correct.
Okay.
5 beds.
Okay. So how concerning is that? I mean, what if we have more people coming in, because we had 16 last night or yesterday, that might need this ICU level of care.
Okay, then we're gonna need to be switching people around, like those 4 individuals who are there, 3 individuals who are there in the Care 2, occupying those ICU level of beds. We're gonna need to move them out to the Care 3 unit and bring those individuals who need ICU level of care. So we do a lot of juggling around, moving around with these individuals. And that's the reason why we really limit and restrict visitors coming in, because we're moving patients around who are COVID positive.
Right.
Lillian, Guam is small, and you hear things. And going back to this gentleman on the ventilator, we just hear from the family that it's not. I, just as a former ICU nurse, and you said this guy's younger, in the 30s. What's it like to see this, and what's different about his case? And of course, not getting into too many specifics, right? But when you see somebody who's young on a ventilator struggling with this thing, what's that like for nurses?
Again, very concerning, and a young individual, with potential in life, but here he is struggling because of the infection that has really severely taken a toll on particularly his respiratory, his lung system. And so I think he has a history of smoking cigarettes. And so that, again, compromised his function of his respiratory, his lungs, because of that history of smoking. And so he's got that factor that definitely did not help or does not help. But, he is on the ventilator. And so we continue to monitor him and hope that, time will heal him, with his lung capacity. But it's sad to see a young individual critically ill like this. And so we're all hoping, and the nurses are doing their best to, hopefully get him through this really battle.
And it looks like that's what we're seeing, is we're seeing a lot of younger people getting COVID. I mean, I'm looking at the breakdown demographics in the SID report, and you have like from 0 to 9 years old, 14, 10 to 19, 30 people with COVID-19, 20, to 29-year-old, 91 people with a COVID-19, 30 to 39, 78 people. That is a lot.
What do you make of these numbers, Lillian? Why are we seeing these numbers with the younger demographic?
Well, as it was mentioned, they're out there. They're young. They think they're not taking it very seriously. They don't think they're vulnerable, but as the governor has pointed out, this virus does not discriminate age or anything. It jumps to a human host. If you're a human being, it jumps to you regardless of your age, your color, your, status. You're a human host for this virus. And so with the young people, remember when the bars open, young people like to enjoy life. And, of course, rightfully so. When we were young, we like to enjoy life, right? And we think we're not vulnerable to anything. But, this virus just does not discriminate anybody. And so the young people we need to just keep reminding them, take heed of this warning, because it can hit you. This virus can just, invade your body at any given moment that you're not wearing your mask, you're not protecting yourself, and you're not protecting others. So wear your mask.
I'm also looking at the SIT report, and it said there were 35 individuals in the government isolation facility. I'm not sure what the capacity is over at, I'm not sure, is it Wyndham Garden or Days Inn? I'm not sure which one is the government isolation facility these days. But are you guys prepping the SNU? Or the SNF?
We are. We're prepping the SNU, and one of the biggest hurdles is still the chiller, the air condition. The 25-year-old chiller system that we have up at SNU, it got repaired. It's still not 100% functional and operational, so it's not keeping the facility cool enough. And so we are working with an institution in the community, donating chillers in the interim while we are in the process of working with a contractor to bring in a brand new chiller and get it installed and get it commissioned. So, you know, in the long run, we're going to get that brand new permanent chiller. In the interim, we are going to be installing and commissioning a temporary use chiller that we hope will keep the facility cool.
Right.
Once we get in place, and we can then, you know, because we're also working to ramp it up. Specifically just for the isolation and for overflow from our acute care facility. And we're ramping it up to have the capacity that if the individuals there at the SIF, their condition deteriorates, that they need critical ICU care, we can keep them there. We don't have to transport them back to this acute care facility here in Tamuning. So that's in the works right now.
Lillian, you know, I remember a few months ago, and I believe this is when we were still in the lockdown, there were a lot of things going on at GMH in terms of trying to increase the morgue capacity and also to do other things in anticipation of this big surge. And then I feel like there was a kind of a dialing back, or if there was, maybe you could just tell us what's the status on these kind of preparations that were being made back when we thought we were going to get the, you know, the 5,000, the 6,000 deaths.
Right. We do have a, I guess it's a container, a refrigerated container that's donated again to give us that capacity, more capacity. It's one container. I think it's a 40-foot, but it can only hold 14 bodies, 14 remains. Fortunately, we are able to maintain or you know, adequately accommodate those individuals who pass on between our morgue, which we have a 12 cubicle capacity, and then the CME morgue, they have a 9 cubicle capacity. And so there's, you know, there are times when it's full, but then the funeral homes work with us to then pick up those human remains and get them processed for funerals. So, you know, whenever they do, then it opens up the space. And so we haven't had to use that container as a backup for morgue capacity. So knock on wood, we won't need it, but, you know. It's always best to have something in place.
Right, right.
I wanted to go back to the SNF, SNU. You were mentioning that you guys were ramping it up and trying to get a donation for the chiller until you were able to purchase a brand new chiller for the Barrigada Heights facility. What's the target date to try and get that up and running? And do you know what the capacity is for the government isolation facility?
Okay. In terms of the government isolation facility, I think it has a capacity of either 40 plus or even up to 50, because right now, as of yesterday, there were 42 individuals at that isolation facility. And so hopefully that some of those people have been already in isolation for so many days that they've met that criteria that they can then be released home and that they are no longer contagious or communicable. Right. So, you know, it's an ongoing process. With regards to the chiller at the SIF, the COVID isolation facility / skilled nursing facility in Barrigada Heights, the target date was yesterday or even last year for that chiller to get replaced. But, you know, unfortunately, you know, the process takes time. So we did the RFQ. We're shooting that we can get that finalized to award the bidder that proposed, you know, the most qualified and, you know, the least expensive for them to then get that chiller where it's at right now, get it transported and installed and commissioned to operate, to run. We're hoping that maybe before the end of August we can get that in place.
Okay. And so because there's no chiller there, is there anyone actually at the SNF facility? Because I was reading, I want to say in the board minutes for one of the last GMH meetings, that there were patients that were over at Catholic Social Services.
Correct. We moved the long-term care residents or patients out of the SIF SNF back in March. He prepared that facility for it to be a COVID isolation facility. We moved them here to our 3rd floor medical surgical annex. And then when we realized that, you know, the numbers are increasing, we want to make sure we protect those residents, because of their age and their condition, makes them very vulnerable to then get infected. We moved them out of here in April to the Catholic Social Services facility. They allowed us to occupy that facility, just to protect them. But so they're there right now. There are no patients or residents at the SNF facility in Barragata Heights, Sabana Drive. No patients are there at all. We do have staff, security guard, and FM to make sure, that the facility is not invaded or tampered with, and they're guarding it and making sure that things are in place and not tampered with or damaged.
Lillian, so there's no aircon up at that facility. Is that what you're saying?
There is. Like I said earlier, it got what we have there as a 25-year-old chiller. It got repaired, but not 100% operational. So it's not keeping the facility as cool.
So
as
is there mold or any kind of mold, or is that an
no?
issue?
That's why we have housekeeping staff there too, to keep it clean on a daily basis.
And how long have the patients been over at Catholic Social Services, and are there GMH staff staffing Catholic Social
Absolutely.
Services?
Yeah, they are still our responsibility. And so, yes, all those skilled nursing unit staff that manage or take care of those patients from the Barragata Heights facility to even here at third floor, we move them up there. And they are the ones taking care of those patients at the Catholic Social Services. And they are still our patients, our hospital patients. They're in our system. They're registered in our system so that we can make sure their medications are transported over from here to that facility. The food, the meals that they need to have, basically everything in terms of like linens we provide, for them there. So they are still our patients.
Right. How long have they been there? I'm sorry.
Since, I think I forgot to answer that question. Since April 14, we moved them there.
Okay. And I think I was reading in the minutes that, is there a contract still pending for this arrangement?
Yes, ma'am. The contract, the agreement, the memorandum of agreement is still pending. And we're lucky that, Catholic Social Services have been very gracious to, not kick us out, not evict us. And so, yes. That is still pending.
And so how much would we have to pay? What's the payment arrangement, or just, I guess?
What we had in the MOA was that, we will pay them $10,000 a month. That's the agreement.
Okay.
All right. Oh, Lillian, I just wanted to ask, so we had public health on in the last week, and they said that because the GDOE nurses who had been detailed to assist public health in things like the community testing, they've all gone back to the schools to prepare for the reopening. And
Correct.
What public health had said was they don't have enough nurses to conduct the community testing. And I know we're moving to the targeted testing, but is the GMH nurses being asked to provide any type of assistance to public health, or?
No, we haven't been asked, and even if they do ask, we really can't support that because we're taking care of the COVID patients, right. And we're still struggling with our shortage of nurses, particularly in the ICU. But the one good thing is, in our recruitment and retention efforts, we are able now to increase our capacity in the ICU from 6 to 8. We can sustain accommodating 8 patients. Our actual physical bed capacity in ICU is 14, but we just don't have the experienced critical care nurses to take care of those patients. But and it's unfortunate that we really continue to struggle with nursing shortage throughout the island. And we like, as much as we like for the DOE nurses to continue helping public health, they also have their responsibility in the school setting. But the concern I have with opening up the school again, these kids, they see each other's masks and they say, "Hey, I like your mask. Let's trade." So things like that, and it just makes it a venue for transmission. And I've said this before, health and life trumps education. We need to protect the health and the life of these children who are also vulnerable. And so, education can wait. I mean, what's another 4 months, right? Hopefully that we have a vaccine by January. And so, I mean, there are other ways to continue the teaching, the education, and the academic needs of these children. But to put them back into the school, we need to really, really look at that and make sure that we protect those children and those students.
Wow, I'm just like, wow, you just...
Sorry, I went off the...
No, that's, I mean, again, Lillian, you always... you always kind of go off, but I feel like it's in a good way, you know what I mean? So that was very interesting to hear. Going back to the nurses, right, as we struggle with these shortages, and I know you said you have an amazing staff, and we agree. What about the burnout, Lillian? How do you... Is there a way to address the burnout without, jeopardizing patient care?
Well, we make sure, I know that we haven't had people go on vacation, but we make sure they have their days off, and we make sure that we don't, stress them out with continuous 7-8 days of working. We want to make sure that they get their time off and they spend it with their family. And if, somebody calls in sick, we say, okay, you take care of yourself. We don't, not like before when we're so short of nurses. Oh man, can you just take Tylenol and come into work?
Wow.
But no, we let them take their days off, and we let them, have time off.
What about the hospital's budget? Are you guys, because I know we spoke with Steve Guerrero from the legislature, and he was mentioning that practically every single agency is going to take a cut. Go ahead.
Go ahead.
Yeah, I was going to say.
No, what Senator Terlahi sent us over the weekend in terms of the substituted bill, looking at what they had allocated for GMH, it's basically the same amount, if not a little bit more. I think it was 29 million, but where they cut back was the pharmaceutical allocation. The governor and we requested 20 million, but the legislature allocated 18 million. But from the general fund, we requested 4 million, but what they gave us was 8 million. So in some ways, they cut back a little bit, but then in another funding source, they bumped it up a little more. So I think, I don't know, I haven't been paying attention, I haven't had time to listen to the legislative session, so
Right.
I don't know if they've already addressed GMH budget and if there were any cuts. I haven't had that information yet. But as of the Sunday substituted bill that Senator Teresa Lai sent to me, I looked at it and it was pretty good.
Right.
And just real quickly before we let you go, I'm sorry, but I wanted to follow up on the Catholic Social Services. You said that they've been handling patients over at Catholic Social Services, moved from the SNF. How many patients are over at Catholic Social Services, and have they been paid anything?
We haven't had a chance to pay because we don't have the agreement, the MOA, official agreement. But we are in communication with Diana Calvo, and so that we want to make sure we make the payment. In terms of the number of patients there, because of the limited space, the maximum that they can accommodate is 11, and so we have 11 right now, residents there.
And these are all Manumco?
They're not all Manumco. These are some individuals who are young but are bedridden and need long-term care. So most of them are, but there are a few who've had early age, a young age of stroke, and so they're kind of like bedridden, and so they need that long-term care management.
Lillian, I want to go back to what you said about the reopening of schools before we let you go, but I think it's almost a mic drop, what you said, your concerns about reopening of public schools in 5 days. Are these opinions that you shared with us, are they opinions that a lot of other medical professionals that share with you?
I haven't really had a chance to discuss it with other professionals, but I have discussed it with our executive team, and they kind of feel the same. But, we also want to respect the school in their mission that, they want to provide the education for the students. And so, okay, let's give it a try, but let's make sure we put in the measures to ensure as much as possible that they can to protect those students and, and prevent the transmission. But and we'll see how it goes.
Yeah.
And I know that they are, they're exhausting all efforts. They're looking at everything to make sure that they have their PPEs and preparing, and they are having also the option of online. So
Well, we have John Fernandez coming up in a little bit, so we'll go ahead and ask him to respond to those concerns. Lillian, thank you so much for your
Thanks,
time.
Lillian.
A lot of great info in there. Appreciate it.
Take care and keep your mask on.
Right on.
Stay
And
safe.
we have a comment here from Mike. Thank a nurse today.
There
So
you go.
thank you guys. Say thank you to your nurses
Yes.
for us.
Thank everybody.
Okay, Esther.
Bye.
Joss, wash your hands on your thumbs. 7:57. We got to take a short break, guys. We're coming back with more of The Link on the Breeze.
Thanks.
93.9.
I was going to say thanks for watching us on TV 11.
Right, and yes, I was. Thank you, KUAM TV 11. Remember, Tuesday, Wednesday, Thursday, Friday, KUAM TV 11. We do it KUAM TV 8 on Monday. All right, so our viewers on TV 11, let's go log on to your grandkids' Facebook and check out our KUAM News Facebook live stream. Okay, because it's Edward R. Murrow awarding. Tu nga si Edward Murrow? Yeah, Familia Murrow. We got an award for it. Check it out. It's our social media at 7:57. Back with more of The Link on the Breeze. Good morning, Guam.
Coming up, some schools push ahead with reopening even as teachers and parents object. Plus, Lebanon's prime minister resigns amid protests over a massive Beirut explosion. And understanding President Trump's COVID relief executive orders. Coming up on the CBS Evening News with Nora O'Donnell.
Yes. Not you. Right. No, let me see if the audio
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
We got your 6.
At 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
Coming up, some schools push ahead with reopening even as teachers and parents object. Plus, Lebanon's prime minister resigns amid protests over a massive Beirut explosion. And understanding President Trump's COVID relief executive orders. Coming up on the CBS Evening News with Nora O'Donnell.
Will influence the federal support our island receives and the community programs we need for the next 10 years and beyond. Respond today over the telephone, in person at home, or at your village census center. Because tomorrow is counting on us today.
Morning. You guys be safe out there. Mask up, wash your hands. Don't talk to strangers.
Stay 6 feet away.
Stay 6 feet away, please. What was that?
That's the cord for the microphone. I don't know.
Okay. Don't look at it. Did you look at it?
I looked at it.
This equipment in here is very sensitive. You look at it the wrong way, it's going to go pout and stand in the corner. You're like, no, I don't want to work. You looked at me wrong. Don't look at it. Don't look at it.
I'm not.
Okay, look away.
Not to.
Look away.
Okay.
803, good morning.
I won't look at my laptop either.
Polka, and they're proud to sponsor this. It's awesome. They got the peach tea, the lemon iced tea, the cappuccino. It's everywhere, okay? Also, Calvo Enterprises and IT&E. Coming up, Education Superintendent John Fernandez. Reminds me of my grandma back in the day.
Go to school.
Yep.
Go to school. I don't care in the COVID. Go to school. I don't care in the COVID.
Yeah, our number is 637-0094 if you've got a question for him, or post it on our stream.
Right, we'll go ahead and ask it. You know, before we get into the news, let's go to the phones real quick at 637-0094. You had a question, sir? Good morning.
Good morning.
Half a day.
Thanks for joining us. How are you doing, my friend?
I was just, I'm good. I was just checking out are they going to be doing the testing today? Are they having anything going on?
No, there is no community testing.
Crazy, right?
We have not heard any sort of testing being scheduled because they're moving towards this target testing where anytime there's a notice of a place that's has a positive case, they're going to deploy. That's what they're trying to do.
Right.
We're meeting with public health to deploy like a team out there to test all close contacts of that particular location. So what we heard from the Joint Information Center in one of their latest releases is that if you are experiencing symptoms, go to your healthcare provider. If you don't have a healthcare provider, then you need to schedule an appointment at their Northern Regional Medical Center, and that's where they are doing testing. And the phone number to call to schedule that appointment is 635-7525.
You got that? 635?
Thank you.
7525. Sir, just tell us, why do you want to get tested?
I was having one or two of the symptoms, and I just want to go get checked to be sure.
Which of the symptoms are you having?
I was just having stuff with the bowel movement and the sitting nausea.
The diarrhea and the nausea.
Mm-hmm.
Yeah.
Yeah, give them a call if you don't have a healthcare provider, 635-7525 or 7526.
Let me ask you this, sir. Do you think that you as a, tax-paying citizen of the island of Guam, do you think that you should have to call up the radio station to find out where you can go to have your government test you for COVID-19? Or do you think that kind of info should already be out here and,
I think they should have something out there stating every day where should be going on at.
Right,
Yeah.
Totally agree. So we'll keep you posted. Let us know if you call and make that appointment to get tested, because with all these positive cases, the clinics are getting overwhelmed.
Right.
We're hearing there's a ton of people showing up to get tested. And I don't understand, why is it now that we're in the middle of this second surge, they want to pull the plug on community mass testing? I don't understand it at all. And we get people, I mean, you're not the only one calling, sir. My WhatsApp, people are just saying, where do we go? Where do we go? Where do we go? And we're just here to give you the info as far as you know. But I feel like, again, the government, you guys got to get out and you got to give the info out here to the people. I mean, give it to us. We're doing our best. But if we don't have it, what the hell am I supposed to tell this guy? Oh, I don't know why they're not having community mass testing. We heard it's the nursing shortage. So it is what it is, sir. Someone famous once said.
Yeah. All right. Thank you very much.
God bless you, man. Be safe, and you wear your mask, especially if you're going around thinking that you got the symptoms. Are you practicing the social distancing?
Yes, sir.
Was there a moment where you felt like you may have been exposed to this coronavirus?
No, negative.
So you haven't been interacting with people from different households with no mask and all that?
No.
You haven't been attending any social gatherings of 50 or more? Or 25 or more?
No, negative.
Were you at the cockfight?
Huh? Where's that at? No, negative.
All right, sir. Okay.
Thank you. Have a good day.
You too, man. Wash your hands. Stay safe. Wear your mask. 807. Yeah.
You weren't going to the bars. Did you dine out?
Right. Yeah, people they want to get tested, I mean, now of all times. Remember when this first started and nobody wanted to get tested?
Yep.
Nobody wanted to get tested. So the messaging that we're putting out, be vigilant, be safe, do your part. It's not being matched by the government effort. And remember, going back, nobody wanted to get tested. Now we've gotten through to our people's thick scalp. We got through. Now they're begging to be tested.
Exactly.
So where are you at? WIA, where are you at? People want to get tested. We did it. We convinced them to want to get tested. Dude.
And if you want to know a little bit more about this strike force and this why we're not having community testing, go to our YouTube page, our channel, and there's an interview with Dr. Hoa Nguyen, and he talks about this move from community testing to target testing.
Right, and that's how thin our resources are, is that it's either one or the other. In a perfect world, maybe with some planning, we could be doing both.
And if you want to go even further back, last week we did an interview with Public Health, the contact tracing team supervisor, Annette Uggan, who broke it down for us as to why they're not doing community testing and how they don't have enough nurses to do this anymore because the DOE nurses are getting ready to go back to DOE for school.
Right, and so it's, I don't know if I want to call it mixed messaging, but we heard, if you will, the real reason why they're not doing the community mass testing is they just don't have enough nurses. We're stretched thin. This, this is a perennial nursing shortage that we always deal with. And I just feel like, God, we are doing our part. I mean, we're slipping up, yeah, but there has to be some kind of mass testing effort for people who are out here wondering if they've been exposed. So call that number, Northern Public Health. For a lot of people, health insurance is a luxury. So, of course, if you have the insurance now, go to the clinic. Call it in, do what you got to do to get tested on your end. But for those without the health insurance, and there's a lot of people, you got to call that 635...
7525.
Right on. It's 8:10. Let's do news now from the KUAM news team with our link update, Adriana Cotero. Good morning.
Half a day. Good morning, everyone. I'm Adriana Cotero with your headlines here on the link. The latest data from the Guam COVID-19 situation report: 16 new cases of COVID-19 was reported out of 541 test samples. 9 cases tested positive at Public Health, 3 tested positive at American Medical Center, 3 tested positive at GMH, and 1 tested positive at DOD. These cases are all under investigation. Of the new cases, 7 cases were identified through contact tracing, 4 cases had recent travel, and were identified in a quarantine facility. To date, there have been a total of 434 COVID-19 COVID-19 cases with 5 deaths, 104 active cases, 325 recovered, and there are 7 hospitalized. Of the 434 cases, 384 were civilians and 50 were military service members. The budget debate continued Tuesday at the legislature. Senators are now diving into the details of how much each line agency will get for this upcoming fiscal year. But before that, they talked about the critical issue of how much money they have to work with. Nestor Lecanto reports.
I'd like to recognize that we have Mr. Byrne.
The governor's office and the legislature's Office of Finance and Budget are only about $7 million apart in their general fund revenue projections, $782 million versus $775 respectively. But there was still a heavy dose of skepticism in the Congress Hall about how realistic those numbers are given the plunge in business activity due to the COVID pandemic.
We are in a very dire state of fiscal fragility. We are on thin ice, maybe not today, because you got the stimulus, and maybe there's a stimulus in sight. I'm talking about the mid to long-term recovery of the territory.
But Budget Director Lester Carlson says they've reviewed the variables and already dropped their original projection by $40 million. These are the numbers now, he says, and they're sticking to them.
You're asking me, do you stand by the fiscal 21 revenues as presented? I stand by firmly, Senator DeCastro, on BBMR's total general fund recommended levels of $781,697,305. I affirm, sir.
And Speaker Tina Muñoz sought the same sort of reassurance from OFB Director Steve Guerrero.
This invisible war has literally taken a big effect on everybody around the world, but here for us, here in our small communities, how do we relate and how do we be fair and how do we continue to maintain the livelihood or the sustainability of us moving forward to be fair and not just take away, because if we take away, we're going to see our community hurt even more.
For now, everything's all right because you're employed, you're receiving federal funds. Federal funds is helping the bottom line as far as revenues are concerned. But once this whole thing comes to an end, there's no guarantee that we will continue to receive, at least generate the levels of revenues we're experiencing now.
Perhaps Guerrero summed it up best. For now, it's all assumptions, he said. We just got to make the best of it. For Guam's News Network, I'm Nestor Lecanto.
Meanwhile, the governor's office issued a news release Tuesday saying it has slashed the general fund deficit by almost half, from $83.4 million at the end of fiscal year 2018 to $47.8 million by the end of fiscal year 2019. The statement was apparently in response to recent public criticism from former Governor Eddie Calvo. Asked about it during the budget session, Administration Director Edward Byrne explained it this way.
The increase in net assets of $30.1 million and a decrease in liabilities of $5.5 million. The increase in net assets are of two types. One is a slight increase in cash of $13 million, but the big increase was in receivables from outside of $11.5 million and from other funds of $14.5 million.
Adelup called it a surplus of $35.6 million, which it said was achieved in just 9 months through aggressive tax collections, maximizing federal funds, and a strict fiscal discipline, including ongoing cost controls. But Adelup also notes that there's no actual surplus available for appropriation.
Paying down is really not a good way of demonstrating what happened. We reduced the deficit, and until we eliminate the deficit, it will always result in a change in net assets and net liabilities.
The final audited fiscal year 2019 financial statement has not yet been completed. And that's the news for now. We'll see you all here at 6 tonight on Prime Time.
Thanks, Adriana. During Tuesday's special Guam Education Board meeting, GDOE Superintendent John Fernandez presented that overall district-wide 60% of students will be staying at home this school year, having selected online or hard copy distance learning, and 38% chose the face-to-face learning option. Fernandez noted that as long as the island remains in P-Core 3, the department is authorized to proceed with allowing students to return on campus on the first day, which is August 17th. Additionally, he said throughout this week, PPEs are being pushed out to all the schools, and in the event of a positive case, a written protocol is rolling out in the coming days. A motion was made by GEB member John Birch to push the start date back by 1 week to August 24th to allow educators more time to prepare. The motion failed with a vote of 5-3. A lot of you have been asking about community testing, and for now there are not any scheduled because it appears there's a move toward what's called target testing, or rather whenever there's an announcement of a hotspot or a business or school that may have a positive case and is closed. Discussions are underway between the Governor's Physicians Advisory Group and Public Health to establish a strike force comprised of nurses, lab scientists, and contact tracers that would be deployed to these hot sites to conduct testing on site of all close contacts. For now, the Joint Information Center announces that for those experiencing COVID symptoms, you're urged to call your healthcare provider. If you don't have one, you can call the Northern Regional Community Health Center to schedule an appointment for testing. That number is 635-7525 or 635-7526. $9.5 million is heading to the Guam Regional Transit Authority. The Federal Transit Administration is awarding the grant to GRTA to go toward improving safety and reliability of the island's bus systems and enhance mobility for transit riders. The money specifically is to go toward buying new electric buses and related charging infrastructure, as well as go toward constructing a new park and ride facility in Dededo. According to Transportation Secretary Elaine Cho, the Trump administration is committed to rebuilding the nation's transportation infrastructure even through the current COVID-19 crisis. The $9.5 million grant Guam is receiving is part of $464 million in federal grants that will help improve the safety and reliability of transit bus services nationwide. In national news, Joe Biden has chosen California Senator Kamala Harris to be his running mate. The decision comes more than a year after Harris, who was also a 2020 Democratic candidate, clashed with Biden over racial issues during the first primary debate. If elected, she would be the nation's first female, first black, and first Asian American vice president. The Secret Service is reviewing a shooting just outside the White House complex involving a man and a uniformed Secret Service officer. Skylar Henry has more details from the White House.
The Secret Service interrupted President Trump just minutes after he started his coronavirus briefing Monday evening. Excuse me? The president was taken to the Oval Office because a Secret Service officer had shot a man just outside the White House grounds.
The suspect approached the officer and told the officer he had a weapon.
According to the Secret Service, the suspect, a 51-year-old male, then ran aggressively toward the officer and withdrew an object.
He then crouched into a shooter's stance as if he was about to fire a weapon.
The president returned to the briefing room as soon as the scene was secure.
I'd like to thank the Secret Service for doing their always quick and very effective work.
The Secret Service has released very few details about the suspect, but the White House says the incident was politically motivated.
It's scary, I will tell you. It is scary that people constantly shovel hate and worse toward the president, the vice president, their families, the people who are closest to them. And that has to stop. I guess people are getting very nervous that he's going to get 4 more years.
White House advisor Kellyanne Conway also tried to link the suspect's actions to nationwide protests and calls to cut police budgets. President Trump has made law and order a key theme of his re-election campaign. The Secret Service hasn't discussed the motive for Monday's incident. Skylar Henry, CBS News, the White House. The White House.
Later in the link, our Decision 2020 coverage continues with senatorial candidates. Democrats Chris Carrillo and incumbent Senator Joe S. San Augustine will also kick off our interview with mayoral candidates. Joining us will be John Gumatautau, who is running for mayor in Asan Maina, and we'll also have mayoral candidate Democrat Andy Santiago. D20 gets underway at 9 o'clock this morning. And he's running in Pneumatic, right?
Yes, ma'am.
Sorry, I shouldn't even look at it.
I told you not to look at it. I got to play back. Did she look at it? She did look. See, told you, Magazzo girl. 8:22. Good morning. It's the link. Yes, we're gonna go right to the Zoom room. We're standing by. I don't know if your ears are burning, John, but we're talking about the public school openings a few minutes ago. We have Superintendent of the Guam Department of Education, John Fernandez. Good morning, John.
Afterday, Chris, and afterday, Sabrina.
Hi.
You guys be careful coming into GDOE headquarters because the superintendent's in the middle of the parking lot right now. Nice background. Soup, I guess just first, we got the big decision from the board. You want to just unpack that for our viewers and our listeners?
Yeah, we, the board had a discussion yesterday, and I guess, I believe, they were, as we head into this final week and before the start of the school year, I think there's, a recognition and acknowledgement of anxiety amongst everybody in our stakeholder community. Looking at the positivity reports coming out over the last week, obviously the FD situation occurred and the shutdown of FD school for a few days. The governor also disclosing her own personal situation, and so I think the board wanted to discuss the possibility of the possibility of delaying the school year for a week. And there was a long discussion. There was a special meeting that was really meant to just check in on the readiness of our school system based on the plans that we had put together. But it did turn into a longer debate that I think reflects a lot of concerns that the community will continue to have so long as we're in this COVID-19 environment. And so at the end of the day, there was a motion made. 5 of the board members voted in opposition to that motion. So the motion to delay the school year did not pass, and the start of the school year remains August 17th. Now that doesn't mean that there is no longer an opportunity to respond to any emergency situations or severe change in the public health environment. It means that decision is going to be left to the superintendent, based on the day-to-day situations that occur. And so, that was a debate last night. I think it was reflective of a lot of what we can anticipate to be anxiety, uncertainty going into the school year. I don't think a week delay would have really alleviated those concerns. But we were there with the board members. It was a healthy debate. We heard from all sides. And also the Guam Federation of Teachers, President Tim Fidenko was there at the board meeting, and his recommendation was to move forward. So, with all the stakeholders in the room, at least on the board the decision again was to go ahead and start as planned and empower the superintendent to make the day-to-day decisions should a situation arise involving COVID-19 on our campuses.
Mm-hmm. Yeah, and I just wanted to follow up on the story that we ran. Because it said that a written protocol is rolling out in the coming days in the event that there's a positive case. So we don't have anything written out or any kind of protocol currently in place?
No, there are. I guess what I wanted to say was that a clearer protocol, and I hope one that's more parent friendly, will be able to be sent out hopefully today. Between the public health and GDOE. So I think you're well aware that in the past, as we've been approached about COVID-19, our standard response has been, we're going to work with public health as we would with any infectious disease for which there is already an existing protocol. And so, for instance, in a TB situation, should there be a TB case involving one of our employees or students, public health would be the first to get that information. They will immediately notify us formally, and then our nurses will mobilize and our social workers will mobilize to assist public health in the contact tracing. And that's a pretty standard protocol, except we're just going to have to modify it for COVID-19, including a much quicker timeline to really notify everybody and to move forward. So I think, as we've said to the public that, we work closely with public health. I think we also realize that, this is a new situation and people kind of want to know what goes on behind the scenes. You know, what you know, after you're notified, what exactly is happening? How long is it going to take? What steps are you going to take? And so I wanted to be a little clearer and ask public health for their assistance, being a little clearer to parents and to teachers and so forth as to what to expect when we notify the community that there is a potential COVID-19 exposure. What we wanted to also state is that it's not simply there's an exposure, therefore full shutdown of the facility.
Right.
We know that exposures are going to happen and could happen in many, many different ways. It could involve a maintenance worker who goes on campus, goes right to fixing a generator or something, and then just checks in at the office and then moves on without any contact with any employees except in that main office. You could have a parent come in and meet with the assistant principal for 30 minutes and then leave, and or you could have multiple students from a household coming in, right? I mean, there's different situations that we have to deal with, and not all of them, based on my conversation with public health, would be an automatic school shutdown. It really depends on the extent of the exposure and the mitigating efforts to clean the facility, perhaps, or to quarantine people due to as a precaution. And we can see that happening. And I think we just want the public to know that in every situation, that there was an immediate communication between our agencies and strong support for both of our efforts, and that we will notify our public as soon as we know the information. So I think that's what I meant. It's just something that parents can understand and which is going on behind the scenes versus just saying that we're working with public health.
Right. John, we had Lillian Posadas from the Guam Memorial Hospital on in the 7:00 hour, and she had some pretty strong words about the reopening of schools, and it basically said that it's going to serve as a grounds for transmission. And later we asked her again to speak on it, and she kind of dialed it down and said you guys did the measures, but this is something I'm sure that you've been hearing, not just in the days leading up to that special board meeting, but maybe even in the hours after it.
We've had that same conversation with many, in this particular situation, and I'm not talking about DOE, but just in general, COVID-19, I think so many people have been bombarded with a lot of information from a lot of sources. In fact, many of us might, in some conversations, consider ourselves experts, having gone through Google and Facebook for the latest and greatest information. I honestly sat down with my team and said, look, let's look at the information, let's evaluate the information, let's determine whether we need to consider a separate type of public health framework for the opening of schools, because right now we're relying on public health, we're relying on our medical experts, our doctors, on the governor's office for that direction as to when we should be considering the opening of schools, and we relied on the PCOR 2 to PCOR 3 shift to give us that direction. And if there's anybody who doesn't feel that we should go in that route, we need to figure out what we're going to do. None of my team wanted to put themselves in the shoes of our medical experts. And so I think the message was we need to communicate our concerns, stay in close contact with public health, and to the extent that they are giving us an assurance that we are in a situation where we can open schools, then let's do our best to follow the CDC guidelines and the safety parameters to make it happen. And I think the plan that we put in place, does that. So I think a couple of things I would say in that regard is, people are coming to me saying, look at all these other states and they're having issues going to school, and I have to distinguish the fact that my understanding with public health is that when we look at our positivity rate, which is about 2% based on our latest 7-day rolling average, that is much different from states like Florida, which is about 17%, looking at Mississippi at 20%.
Right. Yeah, John. But I think people, when they hear that 17%, Florida, Mississippi, they don't really, because we're living in it here, Right. So yeah, and I think people also have issues with the criteria that we used with the PCOR because they've changed it a lot. So obviously, and I know that parents are just very, very concerned, especially with the recent positives, right? And just going to what I had heard, that 60-some%,
right, 62%
opted for
opted for distance learning. So number one, I guess when we look at the positive, we're kind of paying attention to the same statistics that the governor says she's looking at, which is that that 3% positivity threshold and stay below that. So of course, as we get closer to that, we're going to get a little bit more, intense in our communications with public health, because that's the threshold we're given to kind of gauge, how we're doing. But on the models of learning, I also wanted to assure the board that, these pictures that we get from other states where you've got the crowded hallways and playgrounds of everybody coming back to school with no mask, that's not the situation we're planning for. So when we offered our parents the opportunities to choose their learning, I want the parents to really understand that it is their choice whether to send their child to school or not. We offer two options of 100% at-home learning, and about 62% of our parents and students have taken us up on that offer. So 62% of our kids are going to be 100% at home, either online or using hard copy lessons that'll be distributed by the schools to be taken home, to be given lessons, and to maintain contact with the teacher by phone or other means. So that's kind of the process. So that leaves us with about 38% who are going to school, and those 38% are not going to school on the same day. They're actually divided into 3 groups. So on any one day, and I think the average is about only 16% of a school's enrollment is actually going to be in class. So to give our parents an idea of what that means, as I checked in with some of our elementary schools, our large and our small elementary schools, we're really talking about, in an average classroom, about 7 to 8 students would be the norm. And that's in our elementary schools. As we get to high school, what we're hearing from some of the high schools is some of those classes are going to be 5 students, in a classroom face-to-face, because 70% of our high schoolers are going, at home. So I just want to make sure that's people have a better picture of what's going on in the classroom. It's not going to be 24 students trying to stay away from each other. You're going to have 5, 7, 8 students spaced apart, and hopefully more opportunity for our teachers and staff to supervise them and reinforce those safety measures and practices.
Right. I mean, it's almost 1-to-1 for everybody.
And speaking of 1-to-1, where are we with addressing the needs of special needs students?
So, we are hearing from our special needs parents as they work with their schools to revisit their plans for their students. So again, as we've reiterated to our students and our parents, all of it comes down to the individualized education plan that you set for that student during the course of this year. And so we know that some students are still not wanting to come to school, and we have to, we are saying that we're not able to provide one-to-one aids at home. But if you're at school, we know that some students are requesting multiple days. In fact, we have several students who want to come every single day of the week. And so the schools are really empowered to make that determination as part of the IEP process, and whatever they agree upon, we will go and enforce as part of the services provided. So that's really what's being done on a case-by-case basis. So students who normally would be required to go into one of the 3 cohorts actually could go to school every day under their IEP requirements.
John, we talk about the choice for the teachers, the parents, right? So with this surge, rise in positives, our teachers, again, and I've asked this a bunch of times, but it's just because I keep hearing that they are concerned about, not being able to have an option that the parents have about teaching face-to-face or online. If teachers have that concern, they take it to their administrator. Is that how it works? And what if they're in a school that has a high face-to-face enrollment?
Right. So typically, what happens, what's happening now, but typically what happens in the course of normal activities is that teachers are encouraged to seek the whatever accommodation that they require or desire, based on their personal situation, and the administrator is authorized to be able to to see how that can be accommodated within the context of their school, the numbers of kids who are opting to come in versus not, and so forth. And we know that those requests have been made to the school administrators, and we're allowing the school administrators to determine how they want to address that. Again, based on the students who are coming in, should they not be satisfied, and we've had a couple of instances, there obviously would elevate that to our deputy superintendent to resolve to see if there's any possible resolution. We haven't seen too many of those rise to the deputy level. I think we're still in the organizing phase. But yes, we're working to see what we can do in this unusual circumstance.
What about
Go ahead.
Busing?
Yeah, so busing, we're working with, we had several meetings yesterday with Vince Ariola and Jess Garcia and the team over there at the DPW. So, I think, there's certain things that we can plan for, and there's certain things that we're going to have to see how it goes on the first week of school. So we tried to make it as easy as possible on the DOE side by leaving the schedules the same, not changing any attendance areas, so that DPW could maintain the same schedule, the same stops, and so forth. So we want the parents to know, and we will be putting out more information of DPW, that last year's schedules, last year's time and pickup times and drop-off times and stops remain the same. And then what we're going to do is monitor the numbers that come in. But again, what we're talking about is, as we did the numbers, we looked at the expected daily attendance. We assumed that 100% of those daily attendance numbers would ride the bus, and we divided those numbers by the maximum capacity of the bus and the bus system, and it was determined that there should be enough buses, in that mid-90 range to service all the students who are wanting to go on a day-to-day basis to school. Now, we don't expect all of those students to ride the bus, but for planning purposes, we made that assumption, and DPW still was able to say that they thought they could meet that demand. We think that many students were going to continue to do what they normally do, whether it was walk to school. We think there might be a higher number of parents dropping their kids at school if they do have transportation, simply because we're in COVID-19 and there might be that anxiety about riding the bus. On the buses, there will be hand sanitizer, face masks will be required, and then there will be an alternating seating pattern to encourage physical distancing while they are on the bus. I believe 24 passengers is the maximum capacity for each bus.
Mm-hmm. For the 38% that chose face-to-face learning option, are they mainly elementary, middle, high school?
Yeah, so for elementary, the divide was about 40% for face-to-face, and it was and 60% either at home. And when you get up to high school, that number drops to about 31% face-to-face, and then online and hard copy is going to be 69%. So the number was higher in elementary than it is in high school. However, I will say that, of course, as we've led up to the start of the school year, we've been very flexible in letting parents change their model of learning, even after even after we hit the deadline. And so we are seeing some of the numbers move up towards staying at home, based on last week's numbers. And we're still trying to accommodate, those requests.
Mm-hmm. So what if we continue to see more and more cases, positive cases? Because yesterday it was 16. If we keep seeing this climb in cases, do you foresee maybe pushing back the school year, or just moving towards all distance learning and hard copy? Is there like a threshold where you're like, okay, wait a minute, we need to do something here, change our minds? Or
after the board's discussion, I'm going to continue to work with public health and our team to kind of see if there's a special threshold that we ought to be considering regard to the entire district. I think we had already prepared for the possibility of, should a situation happen at a school that requires the kids or teachers to not be at school, or the kids to stay home, we would be moving them into 100% at home, either online or hard copy. So we had already thought through that contingency on a school by school basis. But other than that, we're basically in the same situation as I think the other 15 schools who also have opened. We have about, I would say we have about 15 Catholic schools, St. Paul, St. John's, Harvest, who are already open and running. And I think we're in the same position as they are, ready to open, got all the parameters in place, the PPEs in place, but of course wary about the situation and monitoring it to make sure that we act in the best interest of our students and our employees.
Mm-hmm. And are you guys in need of like school aids or are you guys? Is there going to be more school aides on campus because of the little kids and the swapping of masks and not following social distance guidelines?
Yeah. Are you going to have social distancing police?
Well, because of the numbers and the lower numbers, we've maintained the same staffing levels, and so that's going to help us with the supervision. I think that's really one of the more the assurances that we were trying to provide is that by ensuring that we have really low numbers at school, that will give us an opportunity to evaluate, enforce and reinforce the safety practices, the hand washing practices. I know Chris is going to come out and give hand washing lessons to our kids, but also look at the way we allow them to interact when they're not in class. So all of those I think are more doable under the situation we have now, when we only have about 16% of our kids on campus at any one day. So that's what we considered phase one, and then we'll see how phase one goes, and whether the public health context would allow us to expand that number on campus, or will force us to either stay the same or change course. So again, that's something that we're kind of all in the same boat with us, the charter schools and the private schools, trying to read the tea leaves on the public health situation. But I want to say that Art St. Augustine and before him Linda DeNorsi have always been good in really lending the expertise in the department to our decision making, and especially over this last week, what the Lieutenant Governor indicated is that they would be standing up the Emergency Operating Center for the first weeks of school to ensure that there is a smooth coordination and collaboration with all agencies relative to school opening. I think that's a sign of support for trying to make sure that we do our best in the reopening efforts of our school system.
Say 2 months in, for the parents that opted for distance learning, can they change their mind if they see a drop in cases? Can they say, okay, now I feel comfortable now, I want to put my child in face-to-face?
Or maybe even the reverse, where they're face-to-face and they're like, no, I want to do online now.
Yeah, once we get into the school year, it's going to be more difficult from a scheduling and tracking situation to do that. So the decision probably won't be, the changing of the models will probably be reserved for the end of quarter, to allow for a grading period to take place and so forth. But again, if the situation from a public health standpoint gets intense enough that we need to address, the schools or the entire district, we'll make that decision, for everybody, and try to adjust from there.
John, are you guys going to release maybe info on? So we have 62% of the people opting just for total 100% stay at home. Are there any schools that have zero face-to-face enrollment, or are you able to? Are you guys going to come out with kind of a breakdown of like which school is this and that? And
we have that breakdown for now. It would help us to have our first week of school as well, because what we did, we had about maybe 22,000, 23,000 respondents to our registration. That leaves about 5,000 students perhaps who have not responded. What we did for planning purposes was group them into the face-to-face, so we can understand, the breadth and potential, numbers at the schools or the buses. But we're going to have to wait till that first week to really work with them to clarify that situation. That's one of the uncertain, moving parts, and one of the concerns that I have, because there do seem to be a pocket of households out there that have been where there's been no communication with the school. And we push the schools on their numbers, on their response numbers, and saying, look, you guys are so low. What are you doing to get to those parents? And they're saying that a lot of times they're getting wrong contact information. The numbers, the phone numbers that they had, are no longer working. The minutes might have expired. Some of them are finding it's easier to communicate with the parents on social media because none of the other traditional communications methods are working. So they're, that's one of the situations, because if they're disconnected from their school community, just in terms of the regular communications, my guess is that they're disconnected in many other ways with what's going on in the broader community. And it'll be good for us to get a handle on that and to make sure that we understand, what's going on for those households, so we can ensure that they are taking the appropriate measures and we can, assist as needed.
John, I understand you have some issues with the budget process that's ongoing. Did you care to share those concerns if you have them?
Well, we had a meeting with Senator San Augustine, our appropriations chair, before the budget was released. And, I think at that time we were looking at an $11 to $12 million cut. I think it's probably around 10 million now is what I heard when I spoke to him last night. But, I think the one thing we'll say is that we anticipated there would be difficulty for the entire island based on COVID-19 and based on our projections for next year. And of course, we're not the experts in the revenue projections, so we'll allow them to have that battle. But, we cut $19 million over the last 3 years, and asking to cut, basically to a total of $30 million when you add those numbers back for next year, that's a lot to absorb. And so this week we'll be sitting down with a team to go through, what those cuts will mean. But when we did this exercise multiple times over the last few years, you're now starting to cut into the substitutes and the other,
the meat and the bone, right? The meat and the bone of you guys' operation.
Because ultimately our budget covers personnel costs, utilities, and some of your essential contracts, and beyond that, we rely on our federal funds to kind of help support our curricular, activities and so forth. So we're gonna, we've been working on our reopening, but we are engaging as well in the budget, right. And we will continue to have that discussion. One of the things I did do though is I sent a letter to Vice Speaker Nelson and to Senator San Augustine, and I informed them that one of the assurances that had to be provided to U.S. Department of Education in order for us to access the $41.5 million was an assurance that we would be provided a maintenance of effort, which basically is the average of our last 3 years of support from the government. So, I warned him that would be an issue that we would have to address. I notified, the senators, and we will be contacting USDOE to determine how to proceed. There may be opportunities for flexibility or waiver of that requirement, but, at the very least, I need to notify them now. And my concern, of course, is if they come back and say, you can't access this full amount unless you meet the requirements.
So you inform the senators of that. I mean, I just want to inform them that it's an election year. It's an election year. We're in the middle of an election, and I got to say, education first, education first. That's what we hear all the time. Very frustrating. So now you guys got to go back to the federal government and say, hey, maintenance of effort. Our local government might not be putting as much effort into our public school system as we'd like. So can we just still get that 41 million? That's a lot at stake, John. That's
No, it is a lot at stake.
Yeah.
And that's why we've repeated it in our public meetings with the senators, and we sent them another letter to assure them. Sometimes there's this conversation about, well, why don't you use those federal funds and pay for some of the stuff that we can't pay for? And, the federal government's very clear. Education for the most part is a local responsibility. And so when it comes to education funds, there's a real sense that this should be to supplement what the local government is providing. And so, but we'll see. We'll make that notification to USAID and see what they say, and let the senators know what those ramifications are.
I mean, if they say no, you guys you're out $41 million, then you're also going to be dealing with an additional 30 million in cuts. That's insane. Insane.
Right, and that 41 million again, some of that goes to the private schools, the charter schools, and really is investing in our protective equipment as well as our distance learning supports, trying to purchase new laptops and tablets for our kids. So again, we notified them of that, and we will continue to monitor and notify the feds about that situation.
I wanted to ask about Grab and Go. Is there any discussions about restarting that program? I mean, because you have like 62% students that aren't.
Yeah, right after this interview, we'll have a meeting. We're trying to wrap up some details on distribution of meals for students who are not at school. So that includes students who are face-to-face but are on their off days. and it also includes students who are at home 100% of the time. So, we're working with our main contractor, which is Sodexo, to determine how we can distribute food, but in a different way now that we're back into the school year. So one of the ideas that we're looking at right now is to use the Fridays, which are not a school day under this alternating schedule, to do distribution while the teachers are focusing on their parent and student interventions. We would look at opening up for a couple of hours at every school and being able to distribute bags of non-perishable food items to our families, and that's kind of what we're is on the table right now. I don't know that we'll be able to do a full number of meals once we open the first week of school, but we certainly want to be able to provide the number of meals that they would normally get in a school week, to be able to provide that to them on the Fridays. So once we get those details nailed down and everybody's able to, I don't know that we'll be able to do full, then we can go forward.
And that's separate from the emergency food commodity distribution, right?
That's what I'm talking about is really for the students who are enrolled in
so where are you? So you're looking at a Friday, one big distribution of meals for the kids, but what about that emergency food distribution?
That's also being worked on with, remember, we had a conversation about a week ago with the mayors. So what we'd like to do is pilot distribution in multiple sites using the mayor's either offices or centers in the villages, and try to increase the number of distribution sites with their support to assist in distribution, so we can get that food out in a different way than we were doing over the summer. Over the summer, we were able to manage 2 sites. We had DPW and GPD on site to assist us, and that really was a lot of effort, and we diverted those 2 agencies from their core responsibilities. So what we did is ask the mayors if those who want to participate, please let us know, and then we can work on the logistics of enabling them to be able to distribute directly from their centers or even directly to the households. What we need, of course, in response is all the accountability documentation that needs to go along with that, provided to us, so we can maintain accountability for the food items.
When do you guys plan on making final decisions on both the grab and go and the emergency food distribution?
I'm hoping that we'll have a better sense of, after this meeting today, of the grab and go situation, so we can, because there might be the potential to have it partially up and running on the first week of school, meaning that, I believe that we'll be able to provide breakfast items at least, and then, build from there based on the availability of the food items, on island. But what we're planning to do, and if we can do that, then we'll basically ramp up from there, and hopefully have things in place by September. On the emergency food, well, hopefully I can get an update this week and work with the mayors on the next distribution of food, but that'll look different from what we've been doing over the summer. So, we'll hopefully try to announce something this week, by the end of the week.
There's a question from one of our viewers on our Facebook Live. Will the staff faculty be tested before the school opens?
We've talked about that, and I've asked the public health officials about that, and the answer is no, and it's nowhere is it required to test. And of course I understand the sentiment behind it. I guess the challenge is that once you test, that doesn't mean that the very next day you don't get exposed and require another test. I mean, it might be good for that one day, but I think the ability to test all your teachers and staff and children, it doesn't seem like a practical way of preventing the spread of the virus in the school system, in the schools. And again, my conversations was, is that going to be an effective way to address these concerns? And again, the response that I've received from our medical folks is that once you do that test, you could go home or go out to a restaurant the next day and contract the virus, and then a few days later test positive. So what are we trying to accomplish? I think that's the big big concern.
Or on the reverse, John, you could go and get tested and be negative, but you're actually positive, and they just didn't test you at the right time. So
Right. I mean, so it might give a good appearance of of being safe, but it won't improve our ability to assure anybody that those individuals hours later would have had a different result.
Where are you guys with the teacher vacancies?
Right. So we, typically we do, about this time of the year, well, a little bit earlier, we're kind of running around 50 positions that are still need to be filled, and that's kind of where we are right now. We do have a lot of selections and hiring that's already going on and continuing, but in our latest report yesterday, it looked like there were 50 slots that we needed to kind of focus on. So we're working on that. I think the schools have to have a plan to cover those situations, and that's what we're waiting for from the schools.
Is that pretty significant? 50.
It's not. It's actually it's about the same that we've seen in every year. But again, I think a couple weeks into the school year, as we get a better handle on how teachers are being accommodated and so forth, it'll give us a sense of how the schools are able to adjust to those teaching shortages in this particular COVID-19 school year. So we've got a lot of, I think we've got a lot of ideas, for instance, out there about, well, if you don't have a teacher, but this is a teacher that can do it online, can they teach multiple classes or multiple classes at different schools to overcome that shortage? So I'm sure that those are the kinds of discussions that we can have in this particular year where we're making these kinds of changes.
Right, but do you plan on hiring them before school starts? And what sort of training? Wouldn't they need to go through training? Because we're dealing with like 3 different formats here.
Right. No, so all summer we've been training, and usually
I'm talking about the new hires, the 50 teachers. Like how long would it take to get them up to speed?
Right. Well, that'll be the challenge. I think that again, every school year we're pushing to fill all these positions, before the school year, so they can take advantage of the training. And this year we provided an extra week of training to get all the teachers the extra time to prepare. So those who come in the middle of the school year, after the school year has already started, we'll be relying on the school team for the training that we would need and support that they would need to get up to speed.
What about you, John? You have two kids, right? Are they going face to face, or are they going distance learning?
Well, we gave every parent a choice, and so I gave my kids a choice. My high schooler is going online, and I thought that was the case. My boy wavered between face to face and online, but he chose to go online because he found out all his friends are going online. So honestly, with that, I think. And I think the kids are going through that as well. I think the high schoolers are wondering if they're going to be able to participate in their school activities if they're not at school. And so that's the concern I'm getting from the high schoolers. And from the middle schoolers, it really is depending on their group of friends. And so, they're all like, what are you doing? And if you're going to go, I'm going to go. And if you're not, I'm not going to go. And I think that's, that age group. So, that goes.
God, John, when are we going to have a pep rally again? Was that just like dead and gone until there's a vaccine? Because I was just thinking, man, high school.
We're going to do our best to abide by all the safety parameters. Yeah. One of my concerns is that I'm looking at all these pictures that you see online and people going to these gatherings and parties. And so, we're worried about the whole situation. At school, though, we're going to do our best. And we're not going to do our best. We're going to enforce the safety parameters and ensure that we're not, part of the situation and try not to be a part of the spread. So we'll do our best that we can with the guidelines that we have in place.
All right, John. So in closing, you're basically saying that so many students have opted for online that the number of students in the schools is going to be very manageable because it's going to be so low, and that you guys have put into place the precautions, the safety parameters, and that you also have the ability, the flexibility to respond to surges or exposures or anything like that.
Yeah, we prepared the best that we can. I think the situation that we planned out, as we've reviewed it over and over again, puts us in the best position right now to manage any type of face-to-face interaction. Having those very low numbers on campus will assist us in just really getting used to what this new normal will be. It doesn't mean that there won't be an exposure somewhere that'll impact the campus even from outside in the community, but we do have our plans in place to respond quickly should that occur. And we're looking forward to the start of the school year and making these things happen, making these things work.
All right, thanks a lot, John.
Thank you, John, so much for your time.
Thank you.
Hey, and we'll catch up with you next Wednesday. You have your, first day of school report and all that stuff.
Absolutely. All right.
Okay.
Thanks
Thank
a
you,
lot.
John. God
care.
bless you. Wash your hands.
Yeah, you too.
Okay. I'll see you. 9:01. Very interesting.
Yeah.
I find it's kind of interesting. I mean, it is what it is, right? And that's why we have a choice. But going back to when we had the Parent-Teacher Student Association member of JFK, Ralph Rivera, and he went on and he was like, DOE has all the things, the safeties in place, and we're like, hey, what about your kid? He's like, oh, online. So I mean, that's why you guys have a choice. And I think what the reality is a lot of these parents who are opting for the face-to-face, they really, in most cases, don't have a choice because they're maybe going to work. They don't. I mean, let's be honest. A lot of times, public school doubles as a child care facility. So, and that's where I think a lot of the anxiety comes in, is these parents who have no choice or now they don't have the ability to say, you know what, I don't know if this is safe. Let me keep the kids home. So their kids are going to school, and that's why I think it's important for us to not just get those concerns out there, but to have them addressed by people like John Fernandez. 9:03. It's the link on the Breeze 93.9. It's the link on the Breeze 93.9. Good morning. It's all proudly brought to you by Polka, distributed by Ambrose Inc. all over Guam. Peach tea, lemon iced tea, cappuccino. They got that good. Also, ITD and Calvo Enterprises at 9:07. KUAM News' Decision 2020. Last couple senatorial candidates, and then we're going to move on to mayors. We actually have a couple of mayors this morning. Mayors, vice mayors, the congressional. That's going to be awesome. OPA is running unopposed, but I think we're still getting
DJ.
Yeah, he's confirmed. So, no, I guess he'll just go on and pretend he's got an opponent. It's 9:08, and we'll bring on in the Zoom room here Democrat candidate for Senator Chris Carrillo. Good morning, Chris.
Morning, sir. Morning, Sabrina.
Hi. Good morning.
How are you guys?
We're doing pretty good. Thanks for joining us here, Chris. I just want to get this over with right off the bat here, and this is kind of when you announced. I know the people were sending around the pictures. The government dismisses the case against you, and so this, I guess, kind of centered with. I'll just let you discuss it. How would you address that? Because it's a first-page Google, Chris, and I feel like it's going to come up during this campaign. So,
sure.
Yeah, just if you want to address this bust where it was something like you were, or allegedly, I don't even know how to use the word. And what?
Well, okay, we can address that now.
Okay.
Unfortunately, in 2013, I was accused of a crime. The courts found that the charges violated my civil rights, and they dismissed those charges with prejudice. But, it taught me a valuable lesson. First of all, I was in jail for 9 days, and I met a lot of different inmates, right? And it showed me that there are two kind of inmates that we have, and it actually made me more closer to my brother, who had spent time in Lompoc for 7 years for being an addict. And the one thing it taught me was violent criminals really need to be in prison or incarcerated. But there are a lot of people who make mistakes, are addicted to things, and those aren't really criminals, and they go to jail, and we warehouse these people. We don't provide adequate therapy, and they learn to become criminals. So it was an important exercise in my life. It was an unfortunate incident, but we're past that now, and marijuana is now legal. So I think that we need to normalize its use, and let everyone know that it's not a bad thing, that people like it, and if they do it responsibly like any other thing, then it should be fine.
So do you feel like you were targeted because of your, I mean, obviously you got political affiliations, or on the flip side of that, just to address it, do you think that you were given preferential treatment?
Well, certainly I wasn't given preferential treatment because my bill was $250,000. I'm not going to cast aspersions on anyone or any law enforcement agencies. They felt they were doing what they're supposed to have been doing. They did their job. My attorney did his job, and, we're moving on from there.
Mm-hmm.
Okay.
Right. You mentioned a little bit about your experiences and your brother with the criminal justice system. And so I wanted to ask about whether or not that's something that we're going to see you kind of focusing on, the recidivism rate over at the Department of Corrections, things like that.
Well, certainly I'm an advocate for trying to change the way we rehabilitate our prisoners. I mean, a lot of these people who are in prison, especially for drug offenses, nonviolent drug offenses, we should really take a more active role and trying to rehabilitate them, teach them job skills, get them treatment that they so, they're very vulnerable when they're addicts. And we just need to do a better job at making our people who make mistakes, giving them a second chance, and trying to get them to become productive members of our society, because at the end of the day, we're all one community, and no one here on island has been untouched by drug addiction. Everyone has someone in their family, everyone is a close friend that's addicted, and we just have to do better as a community. Right. And it's really a community effort.
Right, but it just seems like there is this vicious cycle, because we talk about rehabilitation programs, but we don't necessarily have enough rehabilitation programs on Guam. So you see people that are addicts, they try to get help, and then they become an addict again, and they're committing crimes, and they're back in DOC, then they're let out, and then they're back committing crimes. You see what I'm saying? It just keeps going and going and going.
Yeah, it's a vicious cycle, Bree, and there's no one silver bullet that's going to fix it, right? I know DOC tries, they have the RSAT program out there where before they get out, they put these people in treatment to make sure that when they get out, they're going to go and stay out of prison. The problem is people get institutionalized also. And this is one thing I had a conversation with my brother. He told me that, he woke up at 5, they worked out, they ate breakfast, they took a shower, then they hung out, and people get comfortable, especially people who spend a lot of time in prison. Even if it's for nonviolent offenses, they get acclimated to living that kind of lifestyle. So we have to show everyone that there's a better life for them out there. And if they stay strong and stay off of the stuff, right, they need support from their families. They need support from their friends. They got to take themselves out of the situations that tempt them. And it's an important issue to me. It's very important. And it's something I'm going to work on if I'm elected.
Right.
To make sure that we get treatment. Yes.
No, I'm just saying that's good to hear that we're going to have somebody in there if you are elected, concentrating on these sorts of issues. But what else do you plan on focusing on if you're elected into the 36th Guam legislature?
Well, one of the most important things to me is that I want to give as much people access to healthcare as possible. So I've been talking to the insurance companies. I've been talking to my friends in the legislature, friends in politics. And one thing that I want to do is there's the Guam Contractors Association, the Chamber of Commerce, and the Women's Chamber all have group plans where their members can get together and collaborate and procure health insurance to try and drive the costs down. My idea would be to have a cooperative that can be subsidized by the government to get all the private employees. There's 6,000 people in Tumon that work at the Dusit and other hotels down there. There are another 3,000 people that work in restaurants and bars. And if we can get these people to procure health insurance together, not only will we drive the premiums down, but we improve the quality of service and the benefits that they're provided as well. So that would be one big thing that I want to do. And then also I want to work on getting the government to work more effectively for the people by implementing new technological ideas. Like I was in Hawaii for my dad's funeral a few months ago, and I went to Safeway supermarket, and my brother walked in and he renewed his registration at Safeway. Took him 3 minutes. I mean, those are things we can do. small things so we can get the people out of the lines at Revenue Tax, and being at home with their families or just not having to deal with that. And small little things like that, incremental changes that we can make to the way we do things, will go a long way to foster a better relationship between the residents and the government.
So we're going to see the Chris Carrillo get your new driver's license at Chudley Mart bill?
Look, that's not even a bill I'd need to write, right? The administration could make that change right now if they wanted to.
Right.
Right? So it's not a bill. These are just ideas, and we need to... And I know that government employees a lot of times feel like if we implement new technology, that means I'm not going to have a job. I'm not a proponent of laying off any GovGuam employees because I feel that you're just adding to the systemic problem of unemployment that we got going on right now. I'm saying let's take those people that are serving at the front lines of Revenue Tax and we can put them in the back where we can be more actively collecting the taxes that are owed. I think that there's a lot of tax revenue that's out there that the government could capture, and that would allow us to hire more public safety officers. It would allow us to hire more teachers and nurses so that we can provide the critical needs that we need to provide to the residents. And it's just being intelligent and getting rid of some redundancy and using technology to work for us.
Chris, how would you address maybe a twofold question? What people talk about with the Democratic supermajority, not really policing the Democrat administration, and then also if you could maybe address, are you a supporter of special interest legislation, and what's your opinion on that?
Well, certainly I think that this administration has called out that this legislature has called out the administration. I mean, even during the Calvo times, I never seen BJ Cruz calling oversight on the governor's office. So, that was rather unprecedented. We've called out, we've had oversight hearings on the Department of Labor. Me personally, if I see something that's contravenes law or is looking towards something that corrupt, that can be my best friend or anyone, I feel it's my responsibility as an employee of the people of Guam to make sure I hold them accountable. And, I don't know if you guys know, but I'm sure both of you know, but I worked for BJ for a long time. And BJ always told me, Chris, we got to hold our friends. Even we gotta make sure that we watch our friends closer than we watch our opponents. We gotta make sure that our friends are held accountable, and if that means calling oversight hearings on departments that I'm friendly with or whatever, I'm still gonna have to do it because the people of Guam have a right to know what's going on in their government and how their tax dollars are being spent.
Chris, you worked for the public auditor BJ Cruz when he was a senator. You're a staffer now for Senator Pito Terlahi. What was that moment where it went from being the behind-the-scenes guy to, I want my name out there, I want to run?
It was a combination of things, really, Chris. So now, you guys know I came from the legislature when it was a different kind of style of legislature. It was different. People cooperated behind the scenes. They came up with agreements. They didn't go on the floor and have 500 recesses and amendments and things like that. And one thing that I know is that while all of the senators in the 35th really do care about the constituents and want to do their best, a lot of them are new at this and they haven't been in the building and they haven't seen how legislatures work. So although I'm a new face and I have my own ideas, I do understand the legislative process. So I think that one of the things that I just know how to get things done. I've done it in the private sector, I've done it in the public sector, and I've done it in music for 30 years. You don't play music for 30 years if, you don't know how to cooperate with other people in a band. So
I couldn't even last 3 months. Sorry.
And you look at some of the guys I play with, like Mike Rass, he's a different kind of cat, but I can get along with him as long as we focus on doing the right things the right way.
Right.
Well, can you just, for people who don't know that you are a musician, just a little bit more about your background,
your personal background,
right? Because you kind of have a little bit of an accent, but
Oh, brother, you're the kind. Oh, brother.
I got to work really hard to try and cover up my accent because I come from a small island called Kauai where we only get 40,000 people, and our pidgin is really bad there. So I really try and speak as well as I can. But you know, I grew up on Kauai. I went to college, started playing music part-time. And then I started getting asked to go on tour with some, you know, people like Shauna Oahu and Brother Walter, Mana'o Company. And once, you know, in my third year of college, I kind of said, man, I'm doing okay. Just playing music. I don't think I got to do college, which was a mistake in retrospect. But, you know, music and life and politics all have a lot in common. Right? It's all about collaboration. It's all about letting the best ideas come out. Like I can say, I want to do a break this way. And if you come in and say, no, this is how we're going to do it. And then we try it all out and we see what fits. And then that's how we do it when we get live. So they do mirror each other. But, you know, music has been a vehicle for me to have a platform for a long time in Hawaii and also here on Guam. I mean, I've been political ever since I moved here. I married a local girl from Jonya. We have 3 kids, 2 already graduated from FD. 1 son chose that he wants to go to distance learning. And he actually chose to leave private school this year and go to public school because he heard that the distance learning program that the DOE was going to have was better than the distance learning they were going to have at his private school. So I'm happy for that. But you know, I'm very blessed. I've been blessed with some opportunities here. My wife and I own some small businesses and you know, I've been blessed. So really, if I can do anything, I want to make sure that Guam is a better place for my son, for all of our kids, and then we really, really look at how we can make the government work more effectively for the people. And that's really, at the end of the day, that's why I'm running for senator.
Chris, we got 2 minutes here. Are you?
What?
Ready for the close? Go ahead.
Yeah. We've got 2 minutes for your final closing on why people should vote for you.
Okay. Well, first of all, Sabrina, Jason, and Chris, I want to thank you for the opportunity to come on this program and, you know, share my ideas and my viewpoints and a little bit about myself. But look, I'm a small business owner. I'm a dad. I've served a lot of public servants that understand how to get things done. I do understand that being a senator is an important job. And, you know, if you afford me the one of your votes, I can make a few promises to you. Number one, that I'm going to work hard. I work hard for you every single day to make sure that I'm listening to your concerns, your wants and needs, and do what I can to be a proponent for you. Number two, that I'm going to treat the office with the respect and integrity that the office deserves. And number three, no matter if we have a Republican majority or a Democratic majority or whatever candidates you select as senator, I'm going to work with them together to make sure that the best policy comes out and that we are able to serve the people in an efficient way and that we take care of everyone, because at the end of the day, we work for you. And, you know, we need to remember that every day, that we work for the people of Guam and we need to deliver the best quality services we can to them at the lowest tax rates that we can. And that they're safe. You know, we have enough nurses in the hospitals. We have enough firemen. We have enough police officers and customs people to make sure that we're interdicting drugs at the border. These are all responsibilities that we have as leaders. And I hope you give me one of your vote. I am number 15 on the Democratic side. And thank you again for this opportunity.
Thank you, Chris.
Thanks a lot, Chris.
Good luck.
Good luck. We'll see you after the primary.
Yeah. 9:24. Let's keep it in the Zoom room because I know there's a session. You might have heard they're working on the budget. That being said, let's get on here. Decision 2020. Incumbent Democrat Senator Joe San Augustine. Good morning, Senator.
Morning, Chris. Morning, Sabrina. How you guys doing this morning?
We're doing good. Thank you for joining us.
Sure. Thank you for inviting me. I mean, you know, every now and then you call me and I try to ignore your calls, but one day I'm going to have to answer your calls, right? Right, Chris? I mean, you know,
especially this month.
You're going to come visit me again. So that's not a problem.
I ain't visiting anybody because of COVID, so.
We're confined to the Zoom room.
I'll make sure I put a sign, Chris not welcome. It's COVID. But Sabrina, you're welcome to come and visit me.
A day.
You see? Hey.
A day.
Anyway, Chris, How can we help you today?
Well, I see what you did there. Divide and conquer. Right, you do. So let's just talk about that, Senator.
Oh boy.
With the budget, you being the budget chair, let's look at your performance this term. What do you believe are some of the highlights of your performance as the budget chair of the Guam legislature?
Well, you know, on the budget side, Chris. Well, let's start out. Number one, we honestly believe we've promoted a balanced budget in 2020, and you know everything was going great until the COVID hit. Now for 2021, we're just trying to make sure that we don't over budget. We try to keep the costs as conservative as possible. What are some of the accomplishments we did this year? I have to promote number one. If it wasn't for the COVID, I think when we promoted the minimum wage increase, it was helping about 2,300 folks. And then because of the COVID, we promoted the amendment to the Dave Santos Act. So, you know, the other areas, gosh, there's a lot of things I get involved in. You know, my areas are more, the agencies are the Guam Election Commission, the Guam Housing, and GURA. But all the other agencies I participated on trying to find ways to assist every agency here on Guam. And you know, some of the agencies may say today that, wow, you didn't give me a lot of money. Well, you know, there's only so much money you can spread around. And as long as we try to distribute it as equally as possible to ensure that generally everybody's, that every warm body that's in the Gov Guam is being funded. Now, and we're meeting all the mandates that are stated by law. And we're trying to just get through these tough times. And I know that the administration has promoted that we should be seeing better times in the future. But until such time, I just don't want to push more money into the pot and say, okay, well, let's increase here, let's increase. Hold on. We don't know what's going to happen tomorrow. We don't know what's going to happen in a couple months. Now, in the beginning of the next fiscal year, if everything starts to look better, GVB, you know, our third leg of our economy is growing. The opportunity is there. Then okay, let's see how we can promote now, providing more money to education, providing more money to public safety, because you know those are the three areas we need to focus on: public safety, health, and education. And I know for a fact that the education is not getting everything they want. You know, I was on the board of education. We could never get everything we want, and that's the reality of Governor Guam budgeting. There's only
right,
so much.
But now that you're at the legislature, I was going to say, right, you've seen it from the other side, and having now been on this side over at the legislature, maybe they would have thought that you were going to fight for them.
And I am fighting for them, Sabrina. Number one, we need to understand that when you take a look at the budget of Department of Education, let's just take a look at it as a whole. They asked for $300 million. And at the same token, when you take a look at their budget, then let's ask the question, how much have they used? If they had all that money, they've had, even when we gave them $200 million, 220, 219, something like that, how many vacancies did they maintain? Quite a lot. And that always bothers me, because when I was on the Board of Education, we promoted to hire more folks. Unfortunately, there are just not that many people in the market that we can hire. We can't hire every teacher in the world because, number one, we got to worry about, you've got now charter schools, you also got private schools, you also got DODEA. So the population of teachers are not there. And I've always asked Department of Education on several occasions, even when I was on the board, and even today, I said, what marketing program do you have to promote for teachers? I'll give you a good example, Sabrina, is that when you see the military, when they promote, how do they recruit folks in the high schools? On their junior year, the first thing they do, because remember, I'm retired Army, on their junior year, they first come to them and it says, hey, when you graduate, you got a shot of getting enlisted. That's something that I wanted to see, that they should have been promoted at University of Guam and everywhere else, is that if you're in your junior year, you pass the praxis test and all that stuff, you get promoted. I shouldn't have to, have a job fair to hire teachers. I should be seeking them. That is what I really expected. That never happened. It's not happening today. So we'll move on to that one. But And at the same token, technology is now where everybody's heading, and it's something that should have been promoted years ago. Even when I was on the board, we were pushing that, trying to find funding. And if you remember, Sabrina, back then, when I was trying to get elected, the biggest thing was that every time I reached the legislatures, that how can you help the schools? They've always told me that it's too political. Well, you know what? I'm on this side of the street, and every time I'm the one reaching out. I'm saying to the chair, even the previous chairs, what can we do to help you now? And I show them their budget. I show them what's going on, and they're almost like, "But we need help." I says, "How can we help you if you have to first help yourself? Let's get better organized. Let's get this program on track. Let's get technology on." And you know, that's what they're going to promote it. What, 63% of the student population is going to be on technology.
Mm-hmm. Well, I wanted to give you this opportunity, and we've asked this from some of the Democratic incumbents. What would be your response to those who might criticize you as just a puppet for Adelup? A yes man for Adelup? What would be your response?
My response to, what was that again? Sabrina, can you repeat that?
Are you a puppet for Adelup, a yes man for the governor?
What would be your response?
I'm not a puppet to anybody. As a matter of fact, the only puppet I'm to is to my wife and to the Lord above. Every time downtown would ask for something, they'd always say, "Well, Senator Joe, how can you help us on this?" I says, "Well, let's find out first what you got, where you want to go, then we'll see how we can get you there." But no, I'm not a puppet to any administration. As a matter of fact, we have to remember that, yeah, I'm a Democrat, but that doesn't mean that whatever Adelup wants, they're going to get. Take a look at the budget. They wanted, what, 781? I'm only promoting 775. We got to take a look at what we have, what we're going to do. And as much as the administration will love some things, and I've met with the governor on many occasions, the lieutenant governor, and all their staff, and I told them, if we can't see it at the end and it's not for the benefit of the majority of the people of Guam, I won't support it. And I'll just step away and says, you look for your votes on my colleagues, and we move on. And I'm comfortable with that. I'm a puppet of the people of Guam, if that's what you want to hear. Other than my wife is my first puppet master, but other than that, we move on. Go for it, Chris. What you got?
This guy. You don't want none of what I got.
Throw rocks? I won't throw rocks. You know, last administration, Chris, I had to deal with Governor Cavu, Primo. Governor Cavu's my cousin. He threw rocks at me, and I took it, and we moved on. And I worked on this administration.
Right.
And revenue tax.
I guess, Senator,
Okay.
Go ahead,
I wanted to just follow up on the whole puppet question. And can you just give us an instance then where you did bump heads and where you did disagree and you put your foot down with the governor or with this administration?
Well, maybe you can give me an example of where you believe I was a puppet, and then.
Oh no, I didn't say that you were a puppet. I said that what would be your response to those who might criticize you as a puppet. But you said that.
Well, number one, Sabrina and Chris, on several occasions, the staff would contact my staff, and they would try to see how it would stand on a variety of things. And I've told them on many occasions that work with your oversight. I have an oversight of 3 agencies. I deal with the budget. I have the Office of Finance and Budgeting that is monitoring the budget of every agency. We've reached out to every agency and said, "Hey, what are you doing? Why is there's no movement, there's no activity? Let's make this work. Let's not come up with the excuses why it's not working." And that's what the people of Guam wants. They want things to start working in their favor. We need to start promoting public service, not the people servicing only the government. It's the opposite. That's why everybody's been elected, is to serve the people, and that's all I've been doing. I've got a lot of activity in my office, and
right, yeah, and I think that the puppet thing, Senator, it's really coming from your colleagues. I mean, we have them on the show here all the time. They're concerned that you have these meetings with Adelup that they don't know anything about. They're concerned that we're not in committee of the whole, laying this all out and being transparent. So that's where I think that criticism
if any of my colleagues, Chris, are believing that I'm a puppet, well, just because they don't get a phone call doesn't mean that I'm a puppet. Hey, if you want to touch someone, you might as touch, right? Reach out and touch someone. If you want their attention, reach out and touch them. They're oversight of their own agencies. When they call me, we're only talking about budget. They never talk about anything else, unless they're talking about GURA or they're talking about Guam housing. Then that's when I get involved. But if we're talking about the budget in general, Chris and Sabrina, every senator in this body, since I took over beginning of the term, we brief every senator of what's going on. And I know that for a fact, we've never done that before. We've never briefed, I was never briefed on my first term what the budget's gonna look like. Not one senator can say they did not know what was going on what information we have. We've shared everything we've got. Now, if I meet with the governor and the governor says, well, can you work on this? I says, no, maybe not. We're gonna see. And then I reach out to their oversight and say, what can you do for this? So I don't know what my colleagues are talking about. And if they want to throw me on the bus, they need to understand first that I happen to be the driver of the bus. They need to get on the bus, get with the program. Let's get it working for the people of Guam.
All right, Senator. Thanks. Well, we've got about 3 more minutes left.
2.5.
2.5? Okay, right, then 2.5. The floor is yours.
Go for it. Closing statement.
Okay, the floor is mine. Well, Chris, just so that the people of Guam know my background, I'm a former police officer. I'm a former acting compliance supervisor for revenue and tax. I was also an assistant tax investigator. I was also the chairman and member of the Guam Education Policy Board. I'm retired from the Army, National Guard on active duty. I'm also, I'm also a graduate of the University of Guam, graduate in 1990. It took me a long way, so I was committed to fulfilling that. It took me 15 years to graduate because I was persistent. For a fact that I ran before twice, and I know, Chris, you made jokes of that before too, that, wow, maybe we'll give him a shot. He gave me a shot, and I think I've been in action pretty good. And, I'm number 4, Chris, Sabrina, and to the people of Guam, I'm number 4 on the ballot. And I'm number 4 for Joe San Agustin. I would appreciate, and I would humbly ask for the support of the people of Guam for a vote of their confidence, continued confidence, in me continuing to serve the people of Guam.
All right, thanks, Senator.
Thank you, Senator.
We'll
see you in session.
And after the primary.
Right. Good luck. Wash your hands.
All right. Thank you, Chris.
Okay.
Take care. Chris
right
and Sabrina, thank you for the time.
All right. Thank you. Oh, one thing you say about Senator Joe San Agustin is when you get him, he'll answer the questions.
Yep.
9:38, and that's really all we can ask for.
Mm-hmm.
You know what I mean?
He really does have a lot of experience. Like I said, he's Guam Education Board, Rev and Tax.
I'm surprised he wasn't a bus mechanic, because what did he say? If you guys want to throw me under the bus, get on the bus.
She's laughing at us too.
Senator, whenever people throw me under the bus, I always say, pass me a wrench if I'm going to be under here. Let me try. Hey, they need bus drivers over at DPW.
They do.
Yeah,
they do.
At 9:38, let's go in the Zoom room where we wanted to kind of update you guys on the in-office voting that's going on with the Guam Election Commission before we head to our mayor candidates this morning on Decision 2020. So good morning, Ms. Maria Pangilinan, the Executive Director of the Guam Election Commission. Oh, Maria! Good morning. Good morning, Ms. Maria. Nice mask.
Oh, thank you. We wear it all day and all night. Thank you.
That's good. So let's go ahead and tell us status of in-office voting. I know it's ongoing right now. I guess can we just first of all start with, this surge? Maybe people are thinking that they want to get the voting done with. They want to just get it out of the way. What are we have any appointments, any openings today? And then if you could just the process for people to go vote.
Okay, so by today, we should break 1,000. 1,000 voters would have gone through our doors to vote in office absentee. Unfortunately, I'm thinking it's unfortunate that we still have same-day appointments. which means, and the reason I say unfortunate, is because we can accommodate more voters at this time. What one needs to do is simply call our office, 477-9791, make an appointment. We will collect information from you via the telephone to pre-fill your application for absentee. If you want to come in, if you want to walk in, you're welcome to, and that's 4 o'clock to 7 o'clock daily, Monday through Friday. We take appointments from 10:30 to 3:30 daily, Monday through Friday, and appointments on Saturdays, 10 to 1.
And of course, the first hour is Manumco.
Right.
Yes, we open at 9 o'clock, Sabrina, for Manumco. So 9 o'clock to 10 o'clock, we cater to the Manumco and those with medical conditions.
Okay. What about precinct officials still looking to hire?
We've been training. We've received over 600 applications, but Albert was telling me yesterday that quite a few people have dropped out. I think in one day 6 people dropped out because of the spike. So we continue to accept them. The application form is on our website. You can still download it, complete it, and sign it. Send it back to us together with an ID.
Mm-hmm. And for the
I think we've trained, Sabrina. I think we've trained maybe. We're bordering on 300. So we need 335 precinct officials. So by tomorrow we will be not tomorrow but Friday, we will be filling in the gaps. So Friday and Saturday we will continue to have precinct official training, and we will fill in the gaps where people have dropped out.
All right. Well, aside from seeing people dropping out of for being a precinct official, I mean, what are you looking at in terms of like voter turnout? Are you?
That's beyond my pay grade, really, yeah. Sabrina. But we have real seasoned folks on our board, and tomorrow we'll have a meeting. I'll get an update from them.
Right, Miss Maria. But I mean, you've got a little bit of experience yourself. 1,000 in-office ballots cast. Is this? I mean, it kind of seems like it's a record for this early. Or is it?
Yes. Well, for in-office absentee, it is a record. Normally, on a regular primary, we would get about 1,000
total.
If in-office absentee with excuse, we will send to the precincts just a little over 1,000. So we're maybe halfway through, and we have 1,000 already. Right. So in the training, we've been preparing precinct officials we've been spending a little bit more time on processing absentee ballots.
Miss Maria, for those people, because again, I know our people, man, I know that just excuses a lot. Oh, I don't want to get down. I want to go vote, but da-da-da-da-da. And so many times we have to just really hold their hand. And because COVID, I mean, it's okay. Curbside voting at the Guam Election Commission office. Can anybody just drive up and curbside vote, or is it restricted to those persons with disabilities or the elderly? Because you got some young bucks out here, Miss Maria, who just don't want to get down and risk it and go up to the second floor. I mean, it is what it is, right?
Yeah. We want to assure you and the rest of Guam that we're doing all we can. We have screeners downstairs on the first floor, right at the canopy. We have screeners. We have our landlord making sure that the elevators are okay and sanitized, different times of the day. On the third floor, when you get there, you'll be greeted with a hand sanitizer. Our voting booths are sanitized after every voter. Our chairs where people can sit down are sanitized after every use. We try. And Chris and Sabrina, let's another thing we can do is let's put out the word that voters can bring their blue or black pen.
Mm-hmm.
They can bring their blue or black pen and they can use it to vote and to fill out the application forms.
And just real quickly, I was going to say Mayor, but Maria, what's the procedure? We have a question here for disabled voters that can't leave their house, or really anyone that can't leave their house to go vote.
You just call our office at 477-9791. We will take the information down, and our homebound voter coordinator will call back and confirm dates and times of when we can visit.
Okay. All right.
And Sabrina, it's important that we let them know if our homebound if our homebound folks want to vote and they are not registered or they need to transfer districts. August 19th is the last day for people to register and transfer districts. So if anybody still needs to register or still needs to transfer, they can come and vote at the same time by August 19th.
Okay.
Miss Maria, you know the curbside. I didn't know if you answered that. So anybody can go curbside?
Oh, no, I didn't.
Yeah.
I didn't. Okay. Curbside really is for those manamku who find it difficult to get out the car and walk up to the elevator. Yes, that's for them. That's for Tanana and Tunse.
Not for Chris.
So if Chris Barnett,
Okay.
if Chris Barnett is in front, is the car in front, then Chris Barnett is going to cause Tanana and Tunse to wait 15 minutes before they get served.
Yep.
Wow.
That's something he would do.
This is how the rumors Chris Barnett hates Manomko. This is how it all gets started right here.
No,
I get it.
On a serious note, we won't turn anybody away.
Of course.
But we want to, it gets crowded. On last Saturday, I saw that there were over 40, I believe, that were served curbside, and that takes a lot.
Yeah.
Because the ballots are stored upstairs.
Yeah.
The security of the ballot is upstairs, so our staff have to run downstairs to get the ballot to the curbside voter.
Yeah, and so let's also commend your staff. They're working hard along with you, Miss Maria. We got to get back to our candidate interviews, but thank you so much for checking in with us. Okay, thank you. And Chris Barnett loves the Manomko, right?
Yes, Chris Barnett loves the Manomko.
Okay, that's not an endorsement. Thank you, Miss Maria. All right, there you go, Miss Maria Pangilinan from the Guam Election Commission. On that note, let's jump right into our KUAM Decision 2020 interviews, where we head to the village of Asan Maina, Sabrina.
All right, and joining us now is John Gumatauto. Welcome to the show.
Right. Good morning, John. Thank you for joining us. We have 10 minutes. We'll go ahead.
Thank you. Happy Thank you to KUAM for allowing me this opportunity to get my message out to our residents here.
Right, residents of Asan Maina. Man, I don't even know anybody who lives in Asan Maina. So, John, I guess just tell us, what are the big issues in the village of Asan Maina that you feel need to be addressed?
Well, lately I've seen a lot of crime happening in both villages, in Asan and Maina. I think having a very real presence of GPD patrolling our streets, or maybe reestablishing a neighborhood watch program would be beneficial.
So there's currently no neighborhood watch program in Asan Maina?
I'll take that back. There is a like a chat group that we have going on, but as far as physical presence, maybe signs could deter some criminal activity, stuff like that.
What else do you plan on I guess, addressing in SN Maina if elected mayor? Because this primary election is really the make it or break it, because there's no Republicans running in this particular village.
Right. Well, my platform basically is health and safety, infrastructure, budget, of course, and veterans, senior citizens, and the youth. So with health and safety, we're living in trying times right now. Unprecedented issues have come up. A lot of families are having to deal with these social distancing and stuff. So I have developed a plan to address some issues with regard to the COVID situation. I have a lot of plans. I have a vision, a very good vision for our village, SN Maina, and I just hope that I get elected and will follow through with all my plans.
Obviously, in challenging the incumbent mayor, SN Maina Mayor Frankie Salas, what are things that you feel can be done better that maybe he's not doing?
Well, the incumbent Mayor Salas actually does a good job. I have to commend him for that. I served with him on our local parish council. He was my vice president at the time I was president, and we worked well together. But maybe some of the things that I feel can be improved are youth programs. We used to have a very viable basketball team, also a baseball team, and because our multi-purpose court is kind of like under renovation, a lot of the youth take that time that they should be on the court or studying. They don't do anything. So I think to improve the sports activities for the youth is something that I think should happen. And I also have that as part of my platform.
And just real quickly, I wanted to make a correction earlier. I said that that this was a make it or break it primary. There is actually a Republican challenger for SN Maina mayor, and that's Michelle Hope Tyson. So whoever wins would face off with her.
Right. So John, in challenging the incumbent mayor, I know you said that he's doing a good job. Then why are you running?
Why am I running?
Yeah.
Because I love Assen. I love Maina. I love the people that live in it, and I want to make it a better place for all of us. I remember a time growing up where we could leave our front doors, our screen doors open. We don't expect any crime, and I wanna be able to bring the residents that live here at Assen and Maina back to those times where they feel secure in their homes, have nothing to worry about.
Okay.
John, we have a couple minutes here left. You want to go ahead and give your closing?
Sure. Well, once again, I want to thank KUAM for giving me this opportunity. I also want to address the Tautau Assen and Tautau Maina, that I believe that my years of experience as a public servant with the government of Guam, I have over 25 years. I served in the United States Army as a staff sergeant. I believe a lot of the training that I received from the Army, leadership training, also the interaction with myself and the public during my tenure at Revenue and Tax. More recently at Chamorro Land Trust, I think that I'm capable. Basically, I have the leadership skills, and I have a great vision for Assen and Maina. So August 29th, I humbly ask Tautau Assen and Tautau Maina to please vote for me, number 2 on the Democrat.
All right. Thanks,
Thank
John,
you.
and
Thank
good
you, John.
luck to you.
Good luck. Wash
Thank
your
you so
hands.
much.
Okay.
Thank you.
That's
Yes.
Okay.
All right. From SN Maina, We head down to.
We're gonna head down to Umatic, but first we got to gas the radio because it's a long trip. So we'll be right back. We'll take a short break and come back with more on the link. It's the Breeze 93.9.
We're celebrating your GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Half a day. I'm Dr. Jana Manglonia, Medical Director for Public Health. We all play a role in slowing the spread of COVID-19. We must continue to stay strong and practice every day preventive actions to keep our island safe. Maintain a distance of 6 feet between yourself and others. Wear cloth face coverings in public settings. Wash your hands for at least 20 seconds. If soap and water are not readily available, use alcohol-based hand sanitizer that contains at least 60% alcohol. Clean and disinfect frequently used surfaces. Avoid touching your face. Stay home if you're sick. Let's protect ourselves, our loved ones, and our communities. Prevention saves lives. For more information, please call 311 or check out our website at dphss.guam.gov.
The 8, we're KUAM FM. I got you, Guam. A little behind, man. We just had a lot of info to get out to you guys with Lillian Posadas of Guam Memorial Hospital. Of course, Superintendent John Fernandez, GDOE, Let's go ahead and wrap our KWAM News Decision 2020 candidate interviews where we gassed up the radio. Yep, $20 regular. And now we're in the beautiful village of Umatic, where we have mayoral candidate on the Democrat side, Andy Uggan Santiago. Good morning, Mr. Santiago.
Oh. Good morning.
Good morning. Good morning.
All right, so we have you, Mr. Santiago. I guess just right off the bat, I've spent about, I want to say, 15 minutes to 30 minutes total in the village of Umatic this year. So I don't know what's going on in your village, but I know you do. So what are the important issues facing the village of Umatic?
Okay, there's issues right now. You know, my plan on running for mayor is really to unite the people here in Umatic and improve our quality of life. And some of the issues is having meetings. I'm very, we have to have our quarterly meetings so people could be informed of what's going on. We have to improve our community, get everybody united, and implement a lot of activities and programs which we are not really getting at all. We, kids, we don't have a school down here in Umatic anymore. We have to do something for the kids. We have to do a lot of programs. We have no programs at all to keep these kids busy.
Mm-hmm.
Youth activities are just really not existing in there. And senior citizens, we have to go to other villages to entertain our senior citizens. Activities, we need to keep our people here occupied and do something. That's one of the main reasons I'm running, is that we're not getting anywhere here in Umatic. We lost our school. We got a lot of our cemetery is slowly drifting away, eroding away, and nothing is getting done.
Mm-hmm. Wow, so basically it sounds like you're saying the incumbent mayor basically just sucks. Mm-hmm. But, be that as it may, you are going up against Gilbert Uggan in the Democrat primary. So what makes you a better candidate than Gilbert?
Are you guys related?
In some ways, yeah. We're
like second cousin, third cousin?
Yeah.
I'm Prim.
I run last time, and I got so much ideas to beautify the village that I haven't seen anything getting done. Makes me better. I can't say that it makes me better. We have to just, for the benefit of the village, basically. I can't argue with which one is better.
Right. Yeah, I get that the respect. You don't want to call out your opponent too hard because it's going to make it awkward at the family gathering.
Yeah, but Mr. Johnny Kanata, the current mayor, isn't he an Uggan also?
Are you related to the current mayor too?
We're all Kanatas too.
Aye, a day.
Yeah.
So, Andy, you talked about the programs. You said we need more programs for the youth in Umatic. What kind of programs would you want to implement if you were elected and beat your cousins in the election?
We don't have anything with sports program. Get the kids into a competitive sports something for them to look for. We used to have, way back when I was growing up, we always have a basketball team here in Pneumatic, which we're not getting any right now. We just, keep these kids to have some kind of something to be proud of, living here in Pneumatic.
So more sports programs.
Competitive sports is it's good, activities to keep kids, implement some kind of we lost our school here.
Right.
And that school is just sitting up there.
Right.
Do you plan on, what are your ideas? You want to use that school for something else?
Right.
Use that school for some kind of a class or something, program, some kind of a youth program to keep the kids busy.
Right.
Use it as a place to exercise or some form of entertainment for kids.
Right. I know, Andy, the last year that FQ Sanchez was in operation, I went down there for Mess Chamorro, and man, I remember it was the food was awesome, but it's a good facility. You're right, and I'm pretty sure with some touching up, I mean, you could be looking at something that could be used not just for Pneumatic residents, but maybe even the people of Molesto or the people of the South, right? So
that's something. Maybe we can use that as a museum or something to right now, looking back, we don't have anything that people can go to and look at some form of history of the village. Who's our educators here in the village, people that are doing good for the village. We don't have that.
Like a Pneumatic Hall of Fame, right? That's a good idea.
Yes.
But Mr. Santiago, you don't have to be the mayor to effectuate change in your village. So prior to deciding that you were going to run, have you done anything to raise these sorts of issues to the incumbent mayor?
One of my main issue here is to communicate.
And have you communicated your concerns to the current mayor before deciding that you wanted to run?
It's very hard to communicate because he got his own ways of doing things. Oh,
I mean, that's just
like a my way or highway type of. What are you talking about?
Obviously, you have to put some concern about your people. Just having parties is not the way to keep people together. We're doing things down here that are temporary. Building something has to be a community input in that. Whatever you build down here, you're building it to be there to last for so many years, and you can look back and say, that was a good program. That's a good building.
You bring up a good point, Mr. Santiago, because last evening I was up at Mount Lamlam, and there's the crosses, and there was a plaque there, and it said, in 1980 these things were erected. It was a collaboration between different senators, and you talk about building a legacy. So that's what you're trying to do if elected mayor, is maybe look at long-term plans for the village.
I want to put Pneumatic as a place to go and enjoy. Okay, we have a lot of good historical place here in Pneumatic.
Right.
Keeping it nice and get the people involved to maintain these things. We have.
Andy, you have 1 minute. Do you want to just go ahead and tough and close?
Yes. Like I said, my goal in and is to unite the community and get something going. Issues we can talk about, and the main thing right now is having to get people together. Is a meeting, quality meeting is a must here in Pneumatic. We have to let people know what's going on. Yeah. And, security issues is another thing here. Like I attend the meetings, and one time about the police chief coming down here, trying to organize a neighborhood watch, and never materialized. Nothing then. I signed up for it, and I've never got a call to implement this program down here.
Thank you, Mr. Santiago. That's your time.
Okay. All right.
Thank you. Best of luck to you in
Good
the
luck.
primary.
Right.
All right. Thank you.
Okay.
Thank
take
you
care.
for this long distance call, sir.
All right. Thanks.
Okay. Hasta.
Adios.
Okay. Adios. Wash your hands. Wow, he sounds pretty frustrated.
Yeah.
Definitely. And that's what I really love about the interviewing the mayoral. I don't know, why do I always say, how do you say it?
Mayoral.
So it's not mayoral.
No, it's
because it's
not.
senatorial and it's senator, mayor. Why wouldn't it
Did you
be
say senatorial?
Isn't it senatorial? It is.
Yeah.
Don't try and confuse me. I'm a Barnett. So yeah, anyway, I guess it's not mayoral. Yeah, but he definitely sounds very frustrated, man.
Yeah,
but that's what I think
bad,
is
what he was saying.
We get to go into these villages.
No unity.
Right. Wow.
No
Of course,
youth programs.
I'm pretty sure the mayor will have something to say about that when he comes on.
No plans for infrastructure improvements.
No Humanicans Hall of Fame.
A school just sitting there, not being used.
And so we'll just let these voters of Humatic figure out which of these cousins they want to pick. That's just interesting. This is going to be cool to interview the mayoral candidates. Bree, do you know? Am I throwing you on the hot spot? Who's coming on tomorrow?
I don't have the list.
Okay, fine. Hey guys, it's 10:11. Thank you so much, Sabrina. Good job today.
Good job, Chris.
Guys, be careful, be safe, be vigilant, wash your hands, wear your masks, please. Limit interaction, unprotected interaction between yourself and people who are not members of your household. We heard from a doctor who is on the Physicians Advisory Group advising the governor about how to combat COVID-19. He was at a small gathering, not wearing his mask. He expressed his regret about that in an interview that's going to be posted up on our KUAM News Facebook page. All right, so do not, at 12 noon, that'll be up there with Dr. Michael. Don't let your guard down, guys. And if it has been down, pick it back up.
Right. Remember, there's no community testing. 16 tested positive yesterday for COVID-19. You are advised, if you are experiencing symptoms, to call your healthcare provider if you don't have one. This is by appointment only. The Northern Region Medical Community Health Center, they are accepting appointments. The number to call is 635-7525, 635-7525, or 6. Also, you can call the Department of Public Health Medical Triage Hotline. Their numbers 480-7859, 480-6760. 480-7883. We'll post those numbers.
There's also a ADA dedicated number for people with disabilities, 687-6170. Okay, so remember, guys, they're doing targeted testing now, which means that people
they're talking about it.
Oh,
the Physicians Advisory Group is bringing this to the Department of Public Health's attention. They were supposed to talk about it last night during the PAG meeting, and so we just need to follow up with Dr. Hoa and other members of the
But what they're using Northern Public Health is to kind of, with this contact trace, test people who may have had exposure relative to the recent announcement. And so that's why you got to make an appointment, because they've got people up there that they're testing. And
they're testing it for people who are experiencing any sort of symptoms.
Right.
Yeah.
Okay, so just, guys, go get tested. If you got insurance, go to the clinics, call ahead, do your part. do your part, definitely. If you're feeling symptoms, if you're feeling like you've been exposed, call your healthcare provider and they'll tell you where to go from there. It's 10:15. Joe, sir, thank you. Jason Salas, thank you. Ken Sanity, of course, Kengineer, our master control operators, but most especially to you, the people of Guam, who trust us to give you the information every weekday morning. We'll be back at it tomorrow on Thursday. Guys, 7 o'clock hour. Public Health Medical Director, Dr. Jana Manglotnya. We're also going to talk with our territorial epidemiologist, Dr. Ann Poblutsky. Dr. Ann P. is coming on. Okay, so that's going to be key for you guys. Tomorrow we'll also have Revenue Tax Director Daphne Shimizu on to kind of talk tax refunds and everything going on with Revenue Tax and a whole lot more. Okay, my name is Chris. Good job, Bree.
Good job, Chris.
This has been The Link on the Breeze 93.9. Esta. Adios. Bye.